Good afternoon. The Senate Finance Committee is now in session, and we'll start with just a quick rundown of the bills in the order in which they will be heard this afternoon. First, the Senate Bill 714, Senator Kagan. Senate Bill 860, Senator Zucker. Number 725, Senator Peters. Senate Bill 756, Senator Carter. 812, Senator Klossmeyer. 813, Senator Klossmeyer. 810, Senator Feldman. 754, Senator Hayes. 846, Senator Benson. And 856, Senator Hershey. Now, for each bill, the sponsor has whatever time you need to develop the parameters of your legislation. Sponsors have selected one person as a lead proponent in most cases, and that person will have 5 minutes. All other witnesses will have 2.5 minutes each. All right, so we're going to start with 714, Senator Kagan, and you're on.
Thank you so much, Madam Chair. Colleagues, it's great to see you again. This is going to make you very sad, but this is my last appearance before the Finance Committee this year. For the record, I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville, and truly humbled and proud to be the chair of the Next Generation 911 Commission. As colleagues know, for the last 3 years, we have released an annual report based on the commission's work for a year. The commission is made up of 911 center directors, cybersecurity experts, telecommunications folks, a 911 specialist, the Maryland Association of Counties, and many other experts, including 2 senators and 2 delegates. I want to give a special shout out to Senator Ed Riley, a former Finance Committee member, and to our newest senator, Senator Michael Jackson. Also Delegate Sue Krebs. Those have been the 4 legislators who've been working for 3 years on these issues. Today's bill, colleagues, is the omnibus bill, the big package of everything that we are recommending. I'm thrilled to have not just my 911 colleagues with me, but also Congressman David Trone, who is a leader at the national level. And Madam Chair, even though he is not the lead proponent, I wonder if he can go first so he can drop off, and then we'll go to Mr. Souter. But I'll say that again at the end, so that if I remember that. I want to give you all a sense of what it is in this bill, and then happy to take any questions either before or after my amazing witnesses. First off, I know you've all heard me say that 3 people have died in my district when 911 has failed. This is not a nice to have bill. This is not, good guy legislation. This is literally life or death. And Maryland has been in the midst of transitioning to next generation 911. That takes technology, staffing, funding, and much more. And the leadership, Madam Chair, Mr. Vice Chair, and colleagues on the committee has been extraordinary. By passing 9 bills so far, Maryland is truly at the forefront nationally of that transition to next generation 911, especially when it comes to updating our state laws. I'm going to give you a quick overview of what's in this year's bill, just so you have a sense of the breadth. And each of you should have gotten a copy of this report. If you don't have it or want another copy, please let me know. My staff would be happy to bring it to your office. It is also on my website for anyone watching online, CherylKagan.org, and it's easy to find there. So the 911 board has been in existence since 1979 and has been virtually unchanged. So this bill modifies the population on that board. A couple of the colleagues who are testifying today, a couple of the witnesses, are members of the 911 board, which oversees and inspects all of our 24 911 centers. It also helps distribute the state portions of the fees that are collected through all of our phone lines. We are mindful of who should be in that room and casting those votes, and making sure that that we have some folks who are shifting to non-voting, those with special interest, the telecommunications folks, but we're making sure that we have police and fire and emergency management, 911 center directors and cybersecurity, finance experts, and others. So that is one part of the bill. Outages are an enormous problem, and we've spent a lot of time on outages. So if there's a very brief, a 5-minute outage when our constituents are unable to contact 911, there's not enough time to actually notify or get the word out. What the commission came up with was, if there's an outage that's significant, that is more than 30 minutes, that the 911 centers need to know. MEMA, the Maryland Emergency Management Agency, needs to know. And then if it persists, we really do need to get the word out to the general public. So whether that's social media or a press release, to make sure that folks know about it. And in the event of needing police, fire, or paramedics, that they know that here's the way to do it. If you're in Harford County, here's the non-emergency number, here's the way to contact us. But 911 right now isn't working, and it's going to be fixed soon. The question is when and what the threshold is. I want to give a special shout out to Comcast. Sean Looney is one of the witnesses. He's been a dedicated member of the commission, has really helped us make sure that we do this right. So we are tweaking not just the 30 minutes, but also 600,000 user minutes before they would have to report an outage. They would also have to report to the 911 board and explain what happened. And that would probably be in confidential session and not live streamed, because there may be cybersecurity issues involved, and we're fine with that. Pivoting to our 911 specialists, as we have renamed in the law. So these are the courageous women and men who are under the headsets. I want to flag for you The Resilient 911 Specialist. It's a remarkable book written by someone who has been a partner to me in this process. Jim Marshall is nationally known as an expert on the mental health of the women and men under the headset. And the reality is that they are more than twice as high to have suicidal ideation, to attempt suicide. They have post-traumatic stress disorder, or he prefers to call it post-traumatic stress injuries. There is still in our culture too much of a stigma on mental health and seeking mental health support. And so, but there are ways that these 911 specialists can get the support. So we are convening, thanks to the University System of Maryland, convening a very short work group over the summer. And Senator Klausmeier, thank you for your coaching on this. Workers' comp for the 911 specialists should not be the same as police or fire or paramedic. They're not getting, lung disease, but they are having mental health challenges. And so we're considering, and the commission will study over the summer and come back after voting on it in the fall, hopefully come in with 2022 legislation, a very, very narrow presumption for mental health, emotional stress for our 911 specialists. So that is not in this bill, the recommendation, but just simply that we're going to convene and look at the other 49 states. But work-related depression and stuff is really a challenge. And if we can address it, we can have better luck with our recruitment, training, and retention, which is an enormous problem. The last piece of that is that especially under COVID, we've seen just disasters, including a recent death in Arizona, just not enough care and for our 911 specialists. Shifting to geographic information systems, GIS. Those of us in the Washington metropolitan area, or it was a national news story, may remember the tragic story of Fitz Thomas, when the 911 call was ping-ponged back and forth between Montgomery County and Loudoun County. And in the meantime, a beautiful 15-year-old boy drowned before help could be sent. And so getting accurate access to geographic information data is critical. This year's report requires the 24 jurisdictions with in their contracts for their next generation provider that they must insist that only current GIS data be used. Carrie's Law. So Carrie was being beaten and attacked by her husband. Their 9-year-old daughter tried calling 911. Maryland was the very first state in the nation to pass a law requiring, they were in a hotel room and she dialed 911 and couldn't get an outside line because in that hotel she had to dial 9 first and then 911. She didn't know that and Carrie died. So Maryland was the first state in the nation to require that office buildings, hotels and stuff, that you can dial 911 directly without any need for a prefix. The problem is that we haven't had the resources to enforce. So this, the commission is recommending that if the county doesn't have the capacity to do the inspections, that the state fire marshal would have the jurisdiction in order to make sure that no one else dies for that purpose. Many of you may be aware of 988, which is coming in the future. It's not starting until July 1st, 2023 nationally. If you have a T-Mobile phone, it is available now. 988 is a suicide prevention hotline. It will be national. There is significant federal funding at stake. If we use our 911 funding for 988 or for any other purpose. Now, the Finance Committee and the General Assembly, in its wisdom, has put in law that you can't use 911 funding for anything other than 911. We added in this bill, that includes 988. They will have to come up with some other sort of funding, but we're real clear. It will cost us a lot of federal funds unless we make clear that no purpose, and that includes 988.
Ridiculous.
Just a couple more things. There were some people who originally expressed questions or concerns. I think they've all backed off. Verizon was originally, they filed as opposed. Anyway, it's favorable with amendment. They'll share their issue, but they are supporting the bill. Maryland Association for Justice supports the bill, and Comcast, as I mentioned earlier, gave us great service and an amendment that we are fine with. With that, I mean, there's so much to talk about that's this bill, but I know you guys have a long afternoon, so I don't want to take your time. So again, Madam Chair, if I could have Congressman David Trone speak next, and then for the 2.5 minutes, and then we can pivot to Steve Souter, Kevin Canale, and Anna Sierra. That would be great. And with that, I will complete my testimony and am grateful for all the support and leadership this committee has shown on 911 and public safety.
Okay, thank you, Senator. Good afternoon, Chair.
I'm sorry, Madam Chair, did you want to hold questions until after the panel?
Yes.
Okay.
Okay, thank you, Chairwoman Kelly and Vice Chair Feldman and committee members. I'm proud to represent Maryland's 6th District in the U.S. House and appreciate the opportunity to address you regarding Senator Kagan's bill, SB 714, which will improve our state's emergency response infrastructure. The Next Gen 911 Commission has been hard at work for 3 years, and this legislation contains badly needed solutions to the challenges facing our first responders. Senator Kagan's bill highlights the need for policymakers to keep the mental health of our first responders at the forefront. As studies have shown, our heroes are exposed to traumatic events at far higher rates than the typical citizen. We're all too familiar in Montgomery County when in 2019, we lost Montgomery County police officer TJ Bomba to suicide. Since then, Senator Kagan and I have been working in tandem at the state and federal level to address mental health for our first responders. In Congress, I introduced the Cops Counseling Act, bipartisan, bicameral, which would increase privacy protections for public safety professionals and peer counseling programs, which has been identified by the first responders is the most helpful behavioral and mental health resources. In Maryland, Senator Kagan has taken action, and as part of 714, the 911 specialists be given access to psychological training to mitigate the efforts of their stressful roles in our emergency response apparatus. We need to work together, federal, state, local, help our first responders and all Americans who struggle with mental health. As a member of the bipartisan, bicameral, congressional Next Gen 911 caucus, I'm glad to see Maryland taking steps to support our 911 specialists and increase the safety and security in our communities. Thank you, Madam Chairwoman, for having us.
Thank you. And we're glad to hear from our federal partners. We don't hear from them as often as we would like, so we appreciate. Are there any questions? All right, we'll go next then to Steve Sauter. You have the 5 minutes. You got to unmute. You got to unmute. Can you unmute yourself? We're not hearing you. We need you to unmute.
Steve, it's the lower left of your screen. I know you're on a different computer than you normally are. Lower left, you'll see mute and just unmute. Madam Chair, why don't we go to Anna Sierra or Kevin Canale while Steve figures that out? Do you want to do that?
Well, let's figure if he can get unmuted.
Okay. Steve, lower left of your screen. He's at his daughter's house, Madam Chair. He's at a different computer than his home computer.
Okay, all right, then we'll come back. All right, we'll go then to Kevin Canale.
Good afternoon, Madam Chair, members of the committee. Kevin Canale here on behalf of the Maryland Association of Counties in strong support of Senate Bill 714. You have my written testimony. I would like to highlight just a few points for the committee. This bill will help Maryland counties, help Maryland continue its ambitious and important move toward Next Gen 911, deliver these services equitably across the state, and it generally strengthens the statutory framework that governs our 911 system. Counties appreciate that the bill adds necessary expertise to the 911 board by adding additional representation, including a county finance professional, a 911 specialist, and an expert from the cybersecurity industry, and then, of course, a representative to represent persons with disabilities. We also appreciate that the bill makes sure that telecommunications providers promptly notify 911 centers in the event of an outage, which is certainly necessary in order to implement alternative communications methods and to properly provide public notice to our residents. We also know that we have a persistent shortage of 911 specialists, and this bill helps to address that issue by requiring the board to establish and host an information hub that will offer guidance, best practices, and strategies to boost recruitment for 911 specialists. Madam Chair and members of the committee, by bolstering the framework and the resources to guide a successful transition to Next Gen 911, this bill will enhance public safety communications across Maryland and in our local communities, and we'd urge a favorable report on Senate Bill 714.
Thank you very much. And I see that Mr. Sauter has unmuted himself, so you're next, Mr. Sauter. You have 5 minutes.
Chair Kelly, Vice Chairman Feldman, honorable committee members, good afternoon. First of all, thank you, Senator Kagan, for such an outstanding overview of this piece of legislation. Thank you for the opportunity to express my support for Senate Bill 714 and House Bill 989, Public Safety 911 Emergency Telephone System alterations. It is my honor to serve as Vice Chair of the Maryland Next Generation 911 Commission, chaired by Senator Kagan, and as also a member of the Maryland 911 Board representing the public at large. I have spent 53 years in the 911 community since the very first 911 call was made on February 16th of 1968. Including 31 years of combined service as director of the Montgomery County, Maryland 911 Center, the Arlington County, Virginia 911 Center, and the Fairfax County, Virginia 911 Center. The Next Generation 911 Commission has endorsed groundbreaking legislation to support the advancement of 911 in Maryland. As a national leader in 911, the entire country is watching Maryland and often will replicate the upgrades that we have done with the support of the General Assembly. Thank you. I am grateful to the members of the Maryland General Assembly for enacting 9 laws based on 2018 and 2019 Commission recommendations. I am hopeful that you this year will also support Senate Bill 714 and House Bill 989 included in the Next Generation 911 Commission's 2020 recommendations. Needed updates include: 1, adjusting the Maryland 911 Board membership. The composition of the 911 Board has been static since its inception in 1979, more than 40 years ago. As we shift towards the implementation of Next Generation 911, it is vitally important that we bring new interest into the fold. As detailed in Senate Bill 714 and House Bill 989, the 911 Board would benefit greatly from the cybersecurity, finance, accessibility, and frontline 911 specialists call-taking expertise. Number 2, the senator spoke to that among a predetermined manner for carriers to communicate information quickly to our 911 centers, also known as Public Safety Answering Points, or PSAPs. The Maryland Joint Operations Center, as a part of MEMA and commonly called MJOC, they also need to be in the loop on this. A standard procedure will assure that our counties can take the appropriate action and steps to keep everyone informed and safe. Number 3, using consistent geographic information systems data. When we think of 911, we think of telephone poles, wires, below ground vaults for utilities, but the next generation of 911 brings into the 21st century. When we request for assistance in the future, it will come via mobile devices, as well as the use of Global Information Technology, or GIS. Senate Bill 718 and House Bill 989 would use nationally accredited and accepted standards where sharing GIS information. Providing consistency will allow a roadmap for those who do business in Maryland and provide also a better service to those requiring assistance in the time of the emergency. Number 4, implementing Carey's Law. Carey's Law was a result of the tragedy that occurred in Texas in 2013. And as you heard Senator Kagan say, when the mother, Carey Hunt was her name, was assaulted and murdered by her estranged husband in a hotel room, their daughter was right there. Their daughter had been, like all of us had been, grown up and taught that in time of emergency to call 911. She called 911, picked up the phone by the bedside, and nothing happened. She called again and nothing happened, and again and again and again. And she, as a 9-year-old child, did not know that she needed to first dial 9 to get an outside line before she could call 911. Systems like this tend to be used in institutions, businesses, hotels, hospitals, banks, colleges, etc.
I hate to butt in, but you've gone over your 5-minute limit, and we've got 10 other bills to hear.
And I thank you for that heads up, Madam Chairman, and I will thank you very much for listening to date. You will do the wise thing when it comes to these votes, and I thank you in advance for that. Very good.
Thank you very much for your testimony. We're going next to Anna Sierra, and you have 2.5 minutes.
Thank you, Chairwoman Kelly, Vice Chair Feldman, and committee members for having me today to testify in favor of Senate Bill 714. My name is Anna Sierra. I'm the Director of Emergency Services for Caroline County. I'm the Public Safety Answering Point Director, commonly called 911 Center Director, as well as the appointed local emergency manager for Caroline County. I'm a 911 board member responsible for representing counties with populations under 200,000. I am also a Next Generation Commission member where I represent the Eastern Shore counties. I am also the highest jurisdictional official for Caroline County Emergency Medical Services operational program. I share those credentials with you because it's important for you to understand that 911 is a vital part of an interconnected system of emergency services that works together to ensure the safety and security of our Maryland residents. Senate Bill 714's multifaceted approach at improving 911 service and support for 911 specialists is imperative to the larger emergency services system in the state. This bill will increase 911 board membership to include several vital positions. Specifically, it will ensure that public safety answering points or 911 center directors are represented in a geographic basis. Until now, the law has not required any 911 center representation. Given the board's responsibility for not only funding 911 projects, but also setting 911 standards and policy, it only makes sense that 911 center directors would have codified representation on the board. In addition, the board will also expand to include representatives of the disability and accessibility needs community as appointed by the Secretary of Disabilities. This seems particularly timely and appropriate now, as we are all having robust conversations with our communities about the unequal burden that our vulnerable residents have borne in the course of this pandemic. It is important to give a voice to the creation of policy and standards for 911 to the disability community so that they can ensure that those unable to use our traditional 911 access methods are considered in our discussions. This bill will also help local counties like mine support recruiting efforts for 911 specialists. Turnover is high in 911 centers, and counties are routinely looking for new talent to bring on as 911 specialists. That requires funding to be able to fund job fairs, advertise broadly, conduct public recruiting campaigns. This bill will provide some support to counties struggling to recruit effectively and will establish a website for job opportunities for 911 throughout the state. Crucially, this bill also lays out requirements for 911 carriers to report outages to local public safety answering point directors. This is critically important to not just 911 centers, but also emergency managers, as it is our responsibility to effectively and efficiently communicate with the public when emergency services are impacted. Lastly, I would like to recognize and thank Senator Kagan and Steve Souter as our Next Generation 911 Commission chairs and vice chairs. Without them, none of us would be here today to support this bill, which in my opinion is the key to the future of 911 in Maryland. Thank you, committee members, for having me today. I urge a favorable report on Senate Bill 714.
Thank you. We're going next to Sean Looney of Comcast. You have 2.5 minutes.
Good afternoon, Madam Chair, members of the committee. Sean Looney from Comcast. I've been involved with this commission now for 3 years, and it's been one of the most interesting, educational, fulfilling parts of my career. I want to salute Senator Kagan for her passion and leadership on this issue. And Steve and Anna are just representative of the amazing people, thousands of people out there that are answering these calls, responding to these calls. They have been true heroes before the crisis. They will continue to be heroes. And this bill will support them and make their jobs and their lives easier, which is why we're so in favor of it. So, and the other great thing about this core group we have now, we're going to continue to monitor 911 and make changes and adjustments as necessary. As technology evolves, as the industry evolves, we're going to be able to make changes pretty flexibly. We have a nice process in place. We've amended this bill just to address some minor issues and concerns, but I think the bill is a great bill, and we urge the committee to give it a favorable report. Thank you.
Thank you. And finally, we'll hear from James McAllister of the Maryland Association of Justice. Major.
Madam Chair, this is Jim McAllister. The sponsor has correctly indicated that we are all for this bill, and I have nothing more to say unless somebody is dying to hear me say something more.
Okay, that's appreciated, and we're glad to know there is so much strong support for this legislation. Senator Hayes.
Thank you, Madam Chair. Madam Sponsor, I tried to look up the 911 Commission on the website for a reason to just learn. Thank you for your annual 911 bill. But one of the things that I'm unable to tell from the website is the diversity. And as you know, among the priorities of the Legislative Black Caucus this year were some police reform bills. And given the comments of some of our colleagues, I feel like there's still some blind spots, especially as it relates to communities of color, especially in the law enforcement community. I know this bill seeks to improve recruitment. I wonder if you have any ideas or be open to discussions around more equity and inclusion of communities of color, because obviously there's biases that exist and we've been trying to tackle them this year, especially as it relates to recruitment.
Thank you, Senator Hayes. I'll start, but then if anyone else wants to add in. Recruitment of our 911 specialists is a huge challenge. It's done by each of the 24 counties right now, and there is obviously an effort to reflect the diversity. But frankly, it's finding people who are qualified, who want the job, who want to apply for the job, who can withstand the enormous stresses. On the commission, we tried to get a lot of the right people in the room, but the work is not about the commission, it's what happens after that. It's making sure that the technology and the employees are ready to protect people who need police, fire, and paramedics. And then the police, fire, and paramedics need to be trained and certified. The 911 specialists each have to be certified in their jurisdictions at the national level for each of those domains. And they have to be, again, Anna, if you want to do this, I forget the name right now, I'm having a blind spot, but they need to be certified in each of the lanes, actually, to be able to provide appropriate service. Colleagues, I don't know how many of you got to see the TV show that showed the brutal stresses under the headset, and it was a really entertaining show that got great ratings. But it gives an idea of the needs to have diverse, well-trained people under the headset, and that is the goal. So thank you, Senator Hayes, for the question.
Yeah, I guess I'm wondering, and I could follow up offline, like here in the state of Maryland, we're fortunately most talented individuals graduate from even our HBCUs, some of them in nursing and other, career paths that will prepare them, appropriately for whatever certification requirements. I wonder if we could strengthen whatever efforts we would give to these counties and their recruitment to help encourage greater diversity.
Okay, so Ms. Sierra wants to add, but I would just want to say that I was able to get Montgomery College to do a training course, a recruitment and training course for 911 specialists to give them a certification that then they would help them in their application as they applied to be 911 specialists. It's a really hard job. Anna, do you want to talk about what you've been working on the Eastern Shore?
Well, we won't be able to do all of that right now. But I do agree that that's a great source that you're recommending. And we probably, with you coming in as chair, could reach out to all of our institutions of higher ed who have undergraduate programs to see if students would want to do internships with this, especially for many majors that would be applicable.
That would be amazing because, again, recruitment and talent shortages are dire. So if there are folks who want to consider this as a career, that would be fantastic.
And Madam Chair, if I may add one of the things.
I really can't.
Okay.
We've got 9 other bills to get to. We might be here till midnight. Okay. Senator Klossmeyer has a hand up. You got to get unmuted, Senator. Okay.
Senator Kagan, I just want to let you know, we had a workers' comp work group meeting yesterday, and the Workers' Compensation Commission said they have nothing to add to whatever you're doing, and it's a different kind of commission that you need. So I just want to let you be aware of that they don't have anything.
Thank you, Senator Klausmeier. To be clear,
Thanks, Sue.
we didn't want to add to their burden. So we have a consultant who's going to look at the other
Okay.
states and along with the University System of Maryland,
Okay.
we're just going to get a brief report and the data that we will bring to the commission that could result in a legislative proposal for you all to consider next year.
Yeah, because that's all you would have to do is just have a bill like you have right now, and, you know,
Exactly.
maybe we might have an oversight committee.
But very narrow, just to be clear, we're talking about something very narrow for our 911 specialists.
Okay, but I just wanted to give you a heads up on that, that's all.
Thank you so much. Appreciate your leadership on that.
Okay,
Okay, thank you. A lot of good ideas and good people coming in to run the commission. And that's the end of the hearing on this good bill.
Thank you so much, Madam Chair. Take care, everybody.
Okay, we're going next to Senate Bill 860. Senator, you have whatever time you need to lay out the parameters of your bill. Your lead proponent, Cheryl Bose, will have 5 minutes and everyone else will have 2.5 minutes. Okay.
Thank you very much, Madam Chair, Mr. Vice Chair, distinguished members of the Senate Finance Committee. For the record, Senator Craig Zucker here presenting Senate Bill 860. Madam Chair, colleagues, I just wanted to salute the other senators. I understand that there are 4 other bills revolving around workers' comp. So I, in particular, wanted to salute Senator Klausmeier, Senator Peters, and Senator Carter. I know that the wisdom of this committee will work through this and figure out what's best for the citizens of Maryland. But what I thought I'd do is just sort of share with you why I put the bill in and the thoughts behind it. So, look, I mean, this global pandemic, I was walking with actually Senator Kramer today to think about in 9 days last year, 9 days in the future, but last year we were abruptly leaving Annapolis. And, Senator Kramer mentioned, yep, and we're still wearing masks and we're still doing social distancing. And as my children and other children prepare to get back to school, my kids are going back next week. It reminds us on how valuable not only our first responders are, but also everyone that works in the school system, whether you're a principal, whether you're an educator, whether you're in food service, or whether you're building staff. And because of the global pandemic, it brings new risks. And as we're getting everyone back into the building, it's important to make sure that we're doing all we can to make sure that people are able to get paid what they need to get paid, making sure they can take off the time they need to take off, especially when it's related to COVID. So what this bill does is it basically does what we have in other areas of the law when it comes to the state of Maryland, is making sure that it provides for educators, whether they're in the collective bargaining unit or not, people in the building, whether they're part of a collective bargaining unit or not, workplace protections when it comes to workers' compensation, that if they've gotten sick on the job, they're able to take time off and quarantine and do what they need to do. It also talks about that it would be retroactive from when COVID first hit, which would have been March of last year. And it talks about the presumption of when workers' comp would take effect. And obviously, everything needs to be verified. I mean, in order for us to get into the Senate building or the State House, we have to verify that we are COVID free. And the same thing would apply for those folks that are applying for workers' comp who have tested positive for COVID, is they would have to verify that they are in fact have COVID. So I know there's going to be a lot of discussion around this piece of legislation, but I think the one thing that we all agree on is how important our workforce is, and in particular, those folks that are working in public education during these difficult times, that we need to at least send a message that we have their back. And I know we do. That's reflected not only in legislation, but in our budget values. So with that, I'd be happy to turn it over to my panel who has a legal background on it, but this would be providing a workers' compensation for those public school employees who have been contracted COVID.
Let me just ask you one question, Mr. Sponsor, before we go to your panel. Do you think the presumption should be based upon an actual diagnosis of COVID and just on a positive test, given how many false positives and false negatives we're getting?
Yeah, I mean, my understanding is that, and I hope it's in the intent of the bill, but yeah, it would be that if they actually have COVID, not the quick test, but they would have to be diagnosed having COVID and treated for COVID.
Okay, because we got an either or right in your preamble, and so I just wanted to ask you.
Okay.
Okay, we're going next to Cheryl Boaston. You have the 5 minutes. You're going to lay out the parameters of the bill.
Thank you, Chair Kelly, Vice Chair Feldman, and members of the committee. My name is Cheryl Boast. I'm a 4th and 5th grade teacher from Baltimore County, serving as the president of the Maryland State Education Association, representing over 76,000 educators across the state of Maryland. I want to first take the opportunity to thank so many of you for your commitment and recommitment to the students of Maryland through your passage of the Blueprint for Maryland's Future. This will be our pathway out of and recovering from this pandemic. So we strongly support Senate Bill 860, which presumes that educators and other public school employees who truly do contract COVID-19 after reporting to the job site to have suffered an occupational disease in the line of duty. We thank Senator Zucker and Chair Gazone for your commitment to the educators in putting this forward. We also know that there are other bills. Senator Klossmeyer has worked on a similar bill that includes other jobs. This one includes our educators. March 5th marked a year from the state of emergency. March 13th marks the date that many of our schools, all of our schools were closed at that point. But on March 16th, that Monday, our food service providers, our custodians, many of our front office secretaries, payroll departments, all reported to work. And they worked throughout the year in trying to make precautions and safety. But I know as an educator here in Baltimore County, I would get the call from the system that a school site, meal site would be shut down due to somebody contracting COVID there in the cafeteria area where they were making the meals to serve millions and millions of our students and families. So we're excited that this is going retro back to March 5th when we did see sites shut down. The other thing is, as we're learning more about this virus, we hear about the long haulers, people who may have immediately have recovery, but then find long ongoing symptoms from COVID-19. There's still much we need to learn. That's why it's even more important that this be considered under the workers' comp system for occupational disease in the line of duty, because there's so much unknown and it takes people out of their ability at times for periods of time to go back to work, and they don't have the leave or they can't get paid for that. So our educators do want to be back in our buildings, and many of them are, but each day we see school sites shut down because of outbreaks. We've just heard about outbreaks in Baltimore County. We've heard about the athletic outbreaks in Howard County, but these would be outbreaks or COVID that is presumed to be received, or you catch it while you are at work, since we are putting everybody back in some way, shape, or form. So this passage of this bill would give educators peace of mind when returning to buildings. It will also make school systems step up to the plate to make sure that they are truly putting in all the health and safety precautions that have been recommended by the CDC, the Maryland Health Department, and the Maryland State Department of Education. We have checklists that we've combined all of those so that make sure, and one of the biggest things is the ventilation, since this is an airborne virus. Many of our educators, like I said, want to be back. They just want to make sure it's in a healthy and safe environment, and to know that if they do get COVID and have to miss work, that they can file for workers' compensation. This should, this bill, along with Senate Bill 813, work collaboratively so that we can make sure not only are, educators, firefighters, or first responders, that it is a presumption under workers' comp. So we respectfully urge a favorable report for Senate Bill 860. Thank you.
Okay. All right, we're going next to Christy Anderson, and you have 2.5 minutes.
Good afternoon, Chair, Vice Chair, and members of the Finance Committee. I'm Christy Anderson. I'm the General Counsel for the Maryland State Education Association. And I'm mostly here to answer any technical questions that you may have, but I want to hit briefly on a couple of points. First of all, as I think Cheryl indicated, this bill does add another layer of accountability to ensure that local school systems are implementing the health and safety measures properly and fully and completely. Because educators have been assured that there's personal protective equipment available to them, but oftentimes when you walk through the school, you find that hand sanitizers are empty, the wall units are empty, there's no wipes. It's not immediately available, which goes to the point that with an occupational disease, a lot of people say, why educators? And an occupational disease has to be specific to the profession. Educators have less control over their environment. They're put into a classroom with 25 or 30 students. They have to interact closely oftentimes, sometimes even providing physical prompts, not always being able to implement that 6 foot of social distancing. Masks can be difficult to maintain. And so this infectious disease is more likely to occur in their environment, which they have less control over. Someone has given the example of why not state workers? Well, state workers have a little bit more control over their environment. For example, like our support staff, we put in place plexiglass and we put in all of those safety measures, and we don't have 25 or 30 people that you have to interact with on a daily basis. That's not, the teachers don't have that choice. Educators don't have that choice. So this is an infectious disease that does arise, and it's specific to the environment that they have to work in. And so I think it is important that we consider this bill specifically for educators. Another piece of this, with it being a compensable injury or being a compensable disease as defined by the Workers' Compensation Commission, it provides not only medical treatment, but it also, and missed wage replacement, but it also, for our employees that are members of the bargaining unit, it provides additional leave benefits, because under the collective bargaining agreements, there's typically a bucket of leave that's for workers' comp leave. And this, most importantly, this is leave that's separate from sick leave. So for a female-driven profession, which oftentimes they have low sick leave balances because of childbirth or childcare, this provides another, if they are to test positive for COVID and have COVID, it provides them another resource of leave available to them to protect their jobs.
Okay, I hate to say it, but you've exhausted your time. If you could wrap up.
So, I'm just going to urge the committee to vote favorably for Senate Bill 860, and I'm available to answer any questions.
Okay, you said you're legal counsel for the MSE, right?
Yes.
Let me ask you one question. I'm just looking at one of the paragraphs in the bill, and I'm wondering if a person, and you don't just say teachers, here's anybody in the school, let's see, teacher or administrator or support staff. Suppose it was support staff that's sat in an office most of the day doing paperwork. You don't have to answer, but it's kind of a rhetorical question I'm asking. But if the person can be proven to have participated in many obviously risky behaviors in terms of how people may contract COVID. And let's say they were on the center seat of an airline several times before there was adequate maintenance, and they know that that is not recommended. Suppose they walk around freely when they leave school with no mask in indoor places where they are having a meal and so on. Would you want that presumption? Because here we have so many educators, it takes a lot of people to educate our kids, that you could have, if you had some careless members among you, you could have everybody go broke trying to deal with some people who are as responsible for what happened to them as could possibly be under any other circumstance.
This is a rebuttable presumption pursuant to the bill that is before you. So the commissioners for the Workers' Compensation Commission, the commissioners essentially are going to be the gatekeepers. If the school system is aware of risky behaviors, if the school system, because obviously if they request coverage under the workers' comp, it can and it likely will be contested before the Workers' Compensation Commission. And those commissioners will serve as those gatekeepers, because if they had somebody in their household that tested positive within that 14-day window, it
was very helpful to hear you say it's a rebuttable presumption.
Absolutely. So if those risky behaviors are known by the school system, that's all going to come out before a commissioner, and a commissioner will make that determination as to whether or not this really did arise during the course of their employment.
Okay, that was very helpful. Okay, we're going next to Matt Pavola. Mr. Pavola, you got to get unmuted. While he's unmuting, does anyone have a question for Krista Anderson? All right,
There
Senator
we
Hershey.
go.
Senator Hershey, I think, does, Madam Chair.
Okay, then we'll come right back.
Gentle, that's why I flagged it for him.
Okay.
Thank you.
Thank you very much, Senator. Ms. Anderson, can you follow up a little bit more with what the chair's line of questioning was? We talk about environments for these public school teachers. We've talked about risky behavior. How would a commissioner actually go through somebody's background over, I guess the bill says something about 14 days, and be able to establish where this could possibly occur or where this could have been contracted, the way that you were discussing?
The insurers, the school system, workers' comp insurance companies, they will pull all that background information and they will put it before the commission. Oftentimes the insurers hire private detectives. They follow these individuals around once they've made a claim for workers' comp. I mean, it's not unheard of for that to occur, but certainly they would do the deep dive to find out if anybody in their household tested positive, or if they have a second job and they tend bar for whatever reason. All of that would then become discoverable and be put before the Workers' Comp Commission, and that would be done by the insurers.
So, I mean, those examples obviously are a little bit different than just this rebuttable presumption, but let me ask, where are these educators when they're not in the classroom?
There are some, because of their own health concerns, that it's the grocery store and home, because of individuals that they live with or they care for. We have a large number of our members of educators that really, they are very careful about their health and what they've done in order to avoid contracting this disease because of the potential harm to their own health or their family members' health. So
those that are not as conscious about it can be in shopping centers and restaurants, gyms, family gatherings, community happy hours, things of that nature. And a commissioner, if this were to come out, is supposed to be able to check all that background and hire detectives to find out where this individual was and how it's possible that this could have been contracted somewhere else.
The insurers, that's what they do. Anytime an employee files for workers' comp, unless it's clear that it occurred, if it's an accidental injury, or take another occupational disease where, for educators in particular, you'll see vocal cord injuries have been determined and found to be occupational diseases for educators because of their voice overuse. But that once they file a claim for an occupational disease, their background gets investigated. I mean, if they happen to do choir on Sundays or they sing with some other group. I mean, all of that's going to be put before a commissioner to say, is this really an occupational disease attributable to their profession as opposed to some of their personal life activities? But that's the job of the insurer, is to bring forth that information to determine, so that the commissioner can make the best decision in terms of the compensability.
So you're definitely acknowledging that it's possible to contract an illness or COVID outside the classroom, right?
Absolutely, absolutely.
And so then being in any type of risky environment should be enough to deny that claim, right?
It depends. It depends on like when they were in that environment, because we're talking about a period of 14 days.
Right. So let's say they were in that environment within the 14 days. They went to a restaurant, they went to a grocery store, they went to the gym.
It depends on if there was an actual positive test in their classroom. If a child came to school and tested positive, if there was actual exposure in the building, in their particular classroom, like in their environment that they live in, so to speak, for 8 hours a day, it would be, I would say, yes, it's a rebuttable presumption and it could be argued, but I think it becomes a question that the commissioner will have to decide.
Thank you, Ms. Anderson.
Okay.
Thank you, Madam Chair.
Thank you. And Mr. Pavolo got himself unmuted, so we want to hear from him now. And we can come back if there are other questions. Okay.
Thank you for this opportunity, Madam Chair Kelly, and members of the committee. My Senator Klaus Meyer and Senator Jennings, where my office is located, the senator there. Appreciate your leadership along with the chairperson of this committee and on this bill. Thank you, Senator Zucker, for advancing the cause of this very admirable bill. As a member of the Maryland Association of Justice, who's asked me to testify here this afternoon, we certainly favor this bill that directs its attention to a category of persons that the other bills that we'll be hearing this afternoon do not address. Those are all addressed to other individuals like public safety persons, but this one is unique with one exception, is one other bill, but this one is uniquely for paid public school employees for the reasons that Ms. Bost and Ms. Anderson set forth. This is very desirable. It has a lot of protections like the 14 days. Notice too, I think in response to one of the questions, I think yours, Senator Hershey, that it is very specific in saying that they must have been in the workplace. So those teachers that remain home obviously could not avail of this bill. And to that issue about rebuttability, that is unique to this area of workers' compensation law. And believe me, as a practitioner for 39 years, trust me when I tell you, I'm at the commission all of the time, trust me that the defense community and the insurance community does a thorough background check on presumptions. Those that already exist for public safety persons, and now with this bill as well, if there was some untoward conduct, some conduct of going to some of the public places where they contracted it or it was at home, that would come out in testimony, and that would be the kind of evidence mentioned in letter C of this bill, substantial evidence that shows that that could rebut the presumption, and that person, that school teacher then would be denied the benefits of the Workers' Compensation Act. I think that pretty much consumes my 2.5 minutes, Madam Chairperson.
Thank you very much.
Madam Chair.
Senator Feldman, Vice Chair Feldman.
Yeah, Mr. Pafula, just one, basic kind of evidentiary question. Normally, and you work workers' comp, the timeline here. So we're now in March of 21. And if we were to pass this, this goes back, I guess, to March 1 of 2020 under the bill. I mean, do you have any concerns about proving up from an evidentiary standpoint, being able to recreate, 12 months ago, the fact patterns here? It's usually with workers' comp, normally it would be more contemporaneous, with the injury, right? You would be able to, you talk about the insurance side of things to be able to, it's rebuttable presumption, but You don't have to go back and recreate kind of what people were doing or not doing 12 months ago. So this is a little unusual because this isn't the current, it'll be the law now, but it's going back to March 1st of 2020. So that specific question, I'm curious your thoughts on.
Senator Feldman, that's an excellent question. And that you're right. That's one of the unique features for the state of Maryland. I'm sure you know, and members of the committee, that there are many states that were in session when COVID-19 hit. And their laws have creating presumptions like this have been up and running, and they had the contemporaneous evidence you've referred to. That is something of an encumbrance here, a little bit of a problem, but truth be told, we are so backed up. We are so backed up right now at the commission because of this nasty pandemic that these hearings are all happening well before the event. And so that is a problem that is tied on to all of these cases. So I don't think it will pose a greater problem for this than any others. I think that you'll still be able to go back and do the diary and go through where the person had been. And it's a necessary, if I hate to say it this way, but a necessary evil, because we wouldn't want all those school teachers and public school employees not to be able to avail of this bill if it went just prospectively. So many people were in harm's way last spring in these cafeteria workers, as we heard discussed, that it would be so unfair if they couldn't apply for these benefits if this became law. So that's kind of how we view that. Thank you for that question.
Okay, thank you, Madam Chair.
Okay, Senator Klausmeyer. You got to get unmuted. Please unmute yourself, Senator.
I'm trying. Okay.
Okay, you got it.
I'm not used to working with these two computers, but anyway, Cheryl, do you have any idea how many teachers, cafeteria workers have come down with COVID that might have to avail of the workers' comp?
I don't have the numbers, and I see Christy shaking her head. No, I know of personal people that I have worked with who got it in the cafeteria or got it in the school, and they've not been outside of their houses other than work, but that's strictly anecdotal.
But we have no idea, there's not been any kind of like count of.
I believe the school districts, that is one of the items that we have been asking for, is transparency of where the cases are taking place and whether it's a staff or a student in each building. I know on the maryland.gov, it updates it every Wednesday, but it doesn't tell you the actual, whether it's a staff or a student, not the names, because that would be HIPAA. So I'm sure the county health department has the names of who was sick at the date that they were sick with COVID, because that was, I believe, a mandatory reporting of that.
Okay, because I think that's something that we really need to find out and look at, because this whole thing is just bigger than we can imagine, I think. So anyway.
It is. I mean, our local president in Worcester was in the hospital for 21 days after contraction, and she doesn't know when she'll be able to return because of the scarring on her lungs. So I know she's one of the people that I've been in contact with almost on a daily basis.
Okay. All right. Thank you.
Okay. Thank you. All right. We're going next to Matt Pavola. Oh, did we? Oh, we did that. Okay. James McAllister. And he's favorable with an amendment.
Yes. Can you hear me, Madam Chair?
Yes. Yeah.
Okay. My name is Jim McAllister. I'm a workers' comp lawyer. I'm in the commission all the time. Let's look at this as what it is. We're asking the public school teachers to go back to work. Unlike people that stock grocery store shelves who can't phone it in, we could continue to protect these teachers by keeping them learning remotely. But as somebody who has adopted foster kids that attend the Arbutus Middle School, I can tell you, we're all hoping and praying the sooner they get back to school, the better. And I include my kids as joining in that prayer. So what do we need to tell the public school teachers? We need to tell them that if you're going to go back to work, and we're going to ask you to go back to work, then let's protect you. If you get sick, your medical bills will be covered. If you miss time from work, you're not going to have to use leave. If you die, your loved ones will be provided for indefinitely. So there are very important benefits for these people. Now, let me speak to the presumption, and Madam Chair and Senator Hershey, I've dealt with presumption cases. The presumption merely says the burden of proof shifts to the employer. How does the employer disprove that? With the evidence that only they have. Did anybody else get sick on the workplace? Because if nobody else got sick at the workplace, they rebut the presumption. If PPE was passed out and safe practices were used, for instance, students were made to wear masks, they disprove that this person likely caught it at work. The claimant shows up and testifies at the commission. They cross-examine them about, what did you do? Where did you go? Were you going to the restaurant? Did you sit next to Chris Christie at the walkout of a Supreme Court justice? Did you engage in activities that exposed you in other ways? And then the commissioner has to make a decision. So it's not like they don't know how to prove it. They have access to all the information. We can't prove it. How am I going to prove if the employer doesn't voluntarily give me the records that my client contracted it from somebody at work if they don't share that information? What do you think? They're going to turn to the employees and say, oh, by the way, we know you got it at work because 8 other people here have it. Other than word of mouth, because the COVID cases I've handled, that's how people know they got it at work. It's not an employer coming to them and saying, oh, by the way, you were exposed at work. So let's protect the employees, these people that go back to work, and let's put the burden of proof on the people that have all the facts. And what does that do? That promotes best practices, because now they know that as long as they pursue best practices, they require masks, they require PPE, they require these classrooms to be wiped down, they require contact tracing. What have we done? We've created an atmosphere where the teachers can't or are a lot less likely to get it at work.
Very interesting testimony. I hate to tell you, you're out of time.
No, I appreciate that, Madam Chair. It's a great bill. I think these are great people. I always say the reason we have Navy SEALs is some people don't have the guts to be middle school teachers. So we should do what we can.
Now we're going to some unfavorables. Julie Murray. Oh, did we? James Lanier. Oh, I'm sorry.
It's all good, Madam Chair. Thank you very much, Madam Chair and members of the Senate Finance Committee. My name is Jim Lanier. I'm the other Jim associated with the Maryland Association for Justice. We are asking for a favorable report on this bill. I'm going to focus on the retroactivity part, because what the senators have done in this bill is unique to the other workers' comp bills for COVID that exist, that are currently being debated in the General Assembly, which is it is truly retroactive and it has a sunset provision, both of which the Maryland Association for Justice is in support of. The retroactivity is important because if you see from the fiscal note, the first time in which a positive test was reported in Maryland was March 6th. So by retroactive putting it back to March 1st, it's going to cover anyone who would have been diagnosed positive in this state going forward. And with the sunset provision, therefore, it truly is what this is meant to be, which is essentially emergency legislation to get a global pandemic and have the Workers' Comp Commission be able to address a unique situation that none of us have dealt with before. With regard to Senator Feldman's question, if I may, any claimant, whether it's an accidental injury and occupational disease, always has 2 years, at least 2 years, to file the claim. So even if we do make it retroactive back 1 full year, heck, if I was injured back in March of 2020, I could still file the claim today. The only difference being procedural, the burden would be on me currently if I was a school teacher, versus if the presumption goes through and is retroactive, the burden would then just simply be rebuttable. Presumption would be on the school system to show that evidence that's already been discussed. So with regard to the retroactivity, this bill is unique and it does something very important, which is makes it go back to March 1st, 2020 to cover everyone when we knew less and we were protecting less. And when the personal protective equipment and other safety measures that Ms. Anderson mentioned that are in place now were not in place then. So we ask for a favorable finding of this bill. Thank you very much for your time.
Thank you.
Madam Chair. Yeah.
Yes. Yes.
Yeah, just real quick, Jim, and just, I don't know the answer to this, but is the Workers' Comp Commission currently accepting COVID cases as compensable? I mean, is that happening right now?
Yes, sir. So I've had a few, some I've had a couple state worker claims. I actually had one emergency room doctor. The claim was originally contested, but later it was later accepted. We've had to go to contested hearings. And thank you for the question, because this actually leads into why this presumption is important. I had a nursing home person whose job it was to take everyone's temperature at the front door. The nursing home location said, we don't have positive tests at our facility. But then we showed the Maryland, Department of Health record showing that they did. And they said, oh, those positive tests. We didn't mean those. So this is why the presumption is important. As Mr. McAllister said, they hold the material. If I hadn't had the Department of Health's information, I wouldn't have been able to combat their notion that they didn't have any positive tests. So yes, some are getting accepted, some are compensable, some are being denied. I can only tell you about my personal cases. So
Thank you, Madam Chair.
thank you, sir.
Okay, thank you. All right, we're going now to the unfavorables. Julie Murray.
Thank you. Good afternoon, everyone. My name is Julie Murray. I am here on behalf of the Maryland Defense Council. We do urge an unfavorable report on this bill for several reasons, which I'll try to get into as quickly as I can in the 2 minutes that were allotted. To sort of pick up where Senator Feldman left off, the biggest issue with this presumption bill is that it is frankly addressing a problem that does not exist. These cases are being filed before the Workers' Compensation Commission. They are being litigated timely, despite what you may have heard, they're being litigated within 60 to 90 days. And the ones that should be found compensable are being found compensable. If you look at the fiscal note from Chesapeake, you will also see that there are many cases that have been accepted without ever being contested. So we have this system set up very well at the Workers' Compensation Commission, and they are hearing evidence. They are finding claims for people who can prove that direct exposure. They are finding them compensable. The other biggest problem with this bill is that everybody thinks of COVID-19 as a disease because that's what we call it in the, in the common world. The commission, when they have been finding the cases compensable, has been finding them compensable as an accidental injury, which is the correct interpretation under Maryland statutory law. If you look at where 9503 is and what it is in the act, it's a presumption for the occupational diseases, which are by definition slow and insidious. The reason for those presumptions are things like lung cancer, kidney cancer, other types of diagnoses where you can't tell where and when the disease originated. By its very nature, COVID-19 is an accidental injury. We can, as everybody who has put in these bills is arguing, we can pinpoint where it came from. In theory, there is one direct exposure. That, under the Maryland Workers' Compensation Law, is an accidental injury, not an occupational disease. To suddenly find this as an occupational disease, frankly, turns the statutory construction of the act a little bit on its head. We have routinely looked at 9503 as a presumption to which certain classes of people are entitled because of the scientific research addressing first responders, firefighters, police officers, and the natures of certain types of cancers that they are at greater risk of because of their employment. That's the type of presumptions that 9503 has addressed. So those are the types of occupational diseases. It has never been interpreted to address a common disease that can be definitively established and pinpointed and traced back to an exposure. Putting aside that technical challenge, the other issue involved is, which is obviously very significant, is the retroactivity. To have a statute that retroactively goes back by a year is something that we strongly oppose for some of the reasons that were mentioned earlier. The investigation of what a person was doing in a 14-day window 1 year ago is virtually impossible. And this maybe addresses what Senator Hershey was talking about, but by having a presumption, you have shifted the burden to the employer and insurer to now go back 1 year, try to find out what a person was doing during a 14-day period 1 year ago.
I really hate that your time has run out. I'm that in your second variable, and I'm sure some of the others will follow.
I certainly will. Thank you very much
Okay.
for the time.
Okay. All right, let's go to Robert Enton.
Thank you very much, Madam Chairman, members of the committee. Robert Enton on behalf of the American Property Casualty Insurers Association. The first issue I want to talk about is proof of the disease. It's very clear from all the scientific evidence that the most reliable laboratory test for determining whether a person has COVID is a nucleic acid detection test, such as the positive polymerase chain reaction or PCR test. That is clearly the best test. I think, as this body knows, based on what's happened in the Maryland Senate, sometimes you can test negative and sometimes you can test positive, but it doesn't mean you have COVID. What it does mean is you may have been exposed to someone that has had COVID, but it doesn't mean that you have it. So we really think that the standard in this bill, if you're inclined to pass it, would be that you've got to take a good look at the testing criteria, and you've got to make sure that the test that you specify is a test which is clearly going to demonstrate that the person, in fact, does have COVID, not that they just were exposed. The second thing I want to address quickly is the retroactivity. It just seems to me that to pass a bill that affects cases and change the presumption and the procedure and change who has to gather what evidence going back to a year now. What you heard from the other side was that this information about whether or not it was an occupational disease is within the employer's knowledge. With all due respect, if that were the case, we wouldn't have this disease running out of control. You can get it when you're in a bar, you can get it in a restaurant, you can get it at the bus station, you name where. And the person who knows where he's been is the claimant, not the employer. And what are we supposed to do now when the presumption shifts to us and we have the burden of proof to go forward and to put a case on, and we don't have the knowledge? We don't know where the claimant was. We don't know what bars they've been to, what restaurants they've been to, what sporting events they've been to, what gatherings they've been to. That's strictly within the claimant's knowledge, not ours. And now to say, yes, and in addition, we're going to have to try to figure out what you did a year ago, and the burden's on us, we think is just not reasonable. And while we certainly sympathize and we are proud of our educators, we think that there are a lot of problems with this bill, and we hope you give it an unfavorable report. Thank you.
Thank you. We're going next to Drew Jabin.
Thank you, Chair, Vice Chair, members of the committee. For the record, Drew Jabin on behalf of the Maryland Association of Counties, here in respectful opposition to Senate Bill 860. You have my written testimony. I will try to be brief. This bill obviously would expand the scope of presumption for workers' comp claims for public school employees, placing significant costs on school systems and therefore county governments. Under state law, counties would have no choice but to support these additional costs for the county boards of education, competing for local limited funds against school construction, public safety, road maintenance, and other essential public services. To Chair Kelly and Senator Hershey's points earlier, the only way, as has been said by other witnesses, to rebut this presumption under the bill is to show substantial evidence that employment was not a contributing cause. Just because something is discoverable does not mean it will be discovered. With the retroactivity of this bill, the claimant could have been out attending parties, eating in restaurants, or engaging in risky behavior such as not wearing a mask or not social distancing last summer, contracted COVID, and the employer still has a likelihood of being responsible. As a result, these practical effects ultimately make the school system responsible and apply strict liability. So the legislation would definitely create new unbalanced laws to manage workplace COVID claims for education workers, and MACo request an unfavorable report on Senate Bill 860. Thank you.
Thank you. And our final witness is William Kress.
Thank you, Madam Chair, members of the committee. Bill Kress here today on behalf of the Maryland Association of Boards of Education, Workers' Compensation Self-Insurance Fund, which consists of 17 county school boards that collectively self-insure for the purposes of workers' compensation claims. We are in opposition to the bill. I thought Ms. Murray did an excellent job of laying out the issues here and really stole some of my thunder, but let me just reiterate, these claims are compensable. They're accidental injury claims. They're being accepted by employers. They're being accepted at the commission level. So I'm not really sure what the outcry is about or what the burning issue is here we're trying to address. You rightly put the burden on the claimant to show that it arises out of and in the course of employment. If you were to shift this to a presumption and an occupational disease, which it clearly is not by the court's definition of an occupational disease, what you're going to do is turn COVID-19 diagnosis into compensable claims, which we will not be able to defend. I can tell you from personal experience of handling presumption cases back in the days when I tried cases, is that when you take this to a jury on appeal, and you have a school teacher who says they contracted in the classroom, you're going to wind up on the losing end of it 99.9% of the time. That's what we've seen with the heart and lung cases, where the presumptions are placed on the employer to show that they contracted the illness in another manner. And if you look at the data, those claims are almost always compensable. And so what this bill does is takes COVID-19 diagnosis and turns it into a compensable claim, which we will not be able to defend. If there was a big problem at the school boards with these claims being filed and not being found compensable, I could see some merit in this bill, but it's simply not the case. So we would urge the committee to look at the data from Chesapeake related to claims that have been filed and been found to be compensable. That should show you that there's not a major issue out there with COVID claims. Thank you, Madam Chair.
Thank you. Let me just ask, is there anybody on the affirmative side? Maybe we could go back to Ms. Anderson for a minute, since you were an attorney involved with these cases. Could you say yes or no that some of these cases are being found already under the status quo to be compensable?
Not to my knowledge, not to date at this point, that we've had any in the public school setting be litigated or taken before the commission and found compensable.
Okay. Is there anybody on the other side that is aware you've testified in a case of, in which a public school case going back retroactively has been found to be not compensable?
Madam Chair, we're not aware of any cases being denied at the school system level.
Okay.
I agree, Madam Chair. We represent some of the partners in my firm represent some, and they're not aware of any being denied yet either.
So under the status quo, if persons in public education had a claim, they can come forward now under the structure that exists already and make their claim. And there's nothing that you know of that anybody has discussed today as a particular structural bar to their being found impacted by COVID, which is—
Madam Chair, this is Jim
They
McAllister.
can make the case. Is that what you're saying?
Madam Chair, can I address that?
Yeah.
Okay, anyway, again, I practice workers' comp. I'm at the commission several times a week. Here's the problem. In order to file a claim, you have to get a medical expert who says your client caught the virus at work. That costs anywhere from $500 to $1,000. Okay, so if I don't have that report and I don't have a presumption and I filed a claim, I lose. So the presumption basically says I don't need that report. Now, if I don't get that report and they rebut the presumption, then I have no evidence and I lose. But that's the inherent structural problem. And also, we have lots of these claims that have been contested for the very reason that they know on the insurance side that we're not going to get an expert if it's a case involving 2 or 3 weeks of lost wages where somebody went back to work and is pretty much okay. I'm not going to spend $1,000 of the client's money to go get an expert to prove that claim.
Okay, I was trying to understand to be sure we asked all the right questions.
Right, but there is a very definite institutional impediment to those claims.
All right, but you haven't shown it yet today, I don't think.
We're seeing it all the time.
Any other key questions before we leave this bill? All right, thank you. We're going next to Senate Bill 725, Senator Peters. Senator, you've got the time that you need to make your case and to lay out the parameters of your legislation. Your key witness, who has the 5 minutes, is Matt Pavola. And then all of the other witnesses will have 2.5 minutes each.
Madam Chair, I'll be brief. It caught a lot of the first bill, and this is somewhat like that. This is an emergency bill that establishes an occupational disease presumption for employees from public safety and first responder occupations that are suffering from the effects of, of the coronavirus. That's what this bill does. You've had an extensive discussion earlier about it. So why don't we just go to my panel and have them.
All right, and I made a mistake. I said that your key person was Pavola, but it actually is John Quirk, the person that you
Correct.
said.
Yeah, John from the IAF.
All right. All right, so we'll hear from John Quirk and we'll come back. We'll get everybody. Okay.
Actually, Madam Chair, Melissa Bragg is going to be the point person on this, our Vice President for Professional Firefighters of Maryland. More along the lines of a me too on this, just for the record.
Okay, then if that's okay with the sponsor, then Mr. Bragg gets the 5 minutes. Okay.
Good afternoon. Can you hear me?
Or Ms. Bragg, okay.
Good afternoon, Chairwoman Kelly,
Yes,
Vice
we
Chair
can.
Feldman, and members of the committee. My name is Melissa Bragg, and I am the Vice President for the Professional Firefighters of Maryland. We represent over 10,000 active and retired firefighters and paramedics across the state of Maryland. Regarding Senator Peters' bill, Senate Bill 725, we are requesting a favorable report. As firefighters and paramedics, we have been at work on the front lines dealing directly with the pandemic for this entire year since the very beginning, while most have been at home. Our members have been directly transporting and caring for COVID patients daily. We are in direct contact with them often, sometimes all day long, and people are still seeing that right now as we speak. Our biggest concern is that we've had many of our members contract COVID and become ill, and we still do not know what the long-term, the long haulers, what the long-term consequences of COVID will be and how this will continue to affect them over time. So with that, I'm keeping this short and sweet. We thank Senator Peters for his commitment to first responders. And again, we are favorable on Senate Bill 725. Thank you, Madam Chair, for your time.
Okay, let me just ask, you mentioned those long haulers. That's the people
Yes.
who really have a terrible time, maybe the rest of their lives.
And we just don't know yet. We have no idea, so early.
So with regard to this bill, what is it about long haulers you want us to remember?
That this may not be over. While many people may have contracted COVID and may have recovered right now, we don't know what the long-term effects are for them. They could continue to have further health problems down the road directly related to them contracting COVID. And for us as firefighters and paramedics, that could be directly related to having cared for someone that was positive. And one of the things that we've often experienced in this past year is that not everyone is truthful and tells us that they may have it, and not everyone knows that they have it. So while we're taking the proper PPE precautions, when you see it over and over all day long, people are getting sick. And we
Okay,
just don't know what the
so-
long-term effect for them will be.
So
down the
how
road.
does your not knowing affect what the goal of this particular bill?
It does not, but there are certain times that we have been around numerous patients, though we're taking the proper PPE or doing the proper PPE, et cetera, but we still don't have any idea that they may have even had it. And so that's just adding to the numbers of exposures that we have been around.
Okay. I haven't read the whole bill. What am I to take away from this bill that's unique or different than the last bill we had about COVID? What ought we to remember in this case?
Senator, do I defer to you on this?
Madam Chair, I think the next expert will answer that question, Pat McCann.
Okay.
And Madam Chair, if you don't mind, I have to go chair capital
We understand, and we want you to do that. Okay, Senator Bottle has their hand up, I believe.
Thank you, Madam Chair. I'm curious if there have been any claims denied for our first responders who've really done a terrific job caring for all of us. So maybe Melissa could answer that.
I'm not particularly aware of anyone that's had something denied as it stands thus far, and there could be, but I don't know specifically of anyone having had it denied thus far.
If anyone else knows of any claims that have been denied, I'd like to know about those. Thank you, Melissa.
Okay, so now we'll go to John Quirk. Oh, you just want to answer questions?
Who, for me? Excuse me, Senator Kelly?
Yes.
Now I'm just here, kind of, I guess, juggling our schedules, making sure we have coverage on this. But,
we'll go to
I'm
Patrick
here
Andrew.
as a Me Too to support this bill to give our first responders the coverage that they may need should they contract with the COVID.
Okay. Okay, Patrick McAndrew.
Thank you, Chair Kelly. Good afternoon. Chair Kelly, Vice Chair Feldman, and distinguished members of the Finance Committee. Thank you for the opportunity to appear here today in support of Senate Bill 725. I would like to begin by thanking Senator Doug Peters for sponsoring this important legislation. Senator Peters, a decorated military veteran himself, truly understands the terms sacrifice and service. And we're honored that he was willing to sponsor this very important legislation, which I would note compared to the other bills is limited to certain public safety personnel. The fact is, since the pandemic began, our firefighters, EMS personnel, and law enforcement personnel, they don't have the luxury of picking and choosing what calls for service they handle. When there's trouble, they go toward that trouble, whether it's a traffic accident, a medical emergency, some sort of family disturbance. The fact is the exposure to them, the possibility of exposure is very high. Now, currently, each employer and insurer treat COVID cases differently, allowing for the presumption of the exposure under this bill would actually bring statewide uniformity to those public safety personnel that are in fact exposed. A question has been asked about exposure, and I can certainly answer follow-up questions in that regard, but there are cases that have in fact been denied that I am aware of. Now, the threat to public safety of the coronavirus is very real. As of March 1st, the National Fraternal Order of Police has captured data documenting that 437 law enforcement officers have died of COVID-19 across the country. 6 of those officers died here in Maryland. Untold numbers of fire and EMS personnel are similarly affected. Our first responders have been there for us, and we need to be there for them. I therefore respectfully ask that you report out favorably Senate Bill 725, and Madam Chair, I'll certainly stand for questions.
Okay, now they've got you listed here as well as Mr. Lanier, with favorable with an amendment. You want to say anything about the amendment? How was the bill amended from the way it was initially introduced, and is that important too?
It is important. I will let Mr. Lanier speak certainly, but it is important because I requested of Senator Peters an amendment to the bill just to clarify the effective date of the bill. As submitted, the bill would be effective upon passage, but we are submitting an amendment seeking to have it retroactive to March 1st of 2020 when the pandemic struck, just so there can be no question of the time period in which coverage might exist. And with that, I would yield to my distinguished colleague, Mr. Lanier.
Well, that was very important. I'm glad to know that. All right, Mr. Lanier, you're on.
Thank you, Madam Senator. Not to belabor the points, but the one favorable with amendment, in addition to what Mr. McAndrew indicated, is Maryland Association for Justice would like to see it cover all public safety. And there's unfortunately one category of public safety that the Senator Peters has left out, and that's correctional officers. We have firefighters and we have police officers, but the other kind of leg of that three-legged stool is the ones who take care of the bad apples once they're already prosecuted. And that's the correctional officers who just like police and firefighter, have no choice and must go to work, and they have to protect themselves. So we would ask, in addition to, I would adopt the testimony that we provided on the other bills, but specifically for Senator Peters' bill, we'd ask it to be favorable with amendments with the retroactivity and to add correctional officers. Thank you.
Okay, that's helpful to know. Has the amendment already been incorporated in the package that we're looking at today to include the correctional officers, or do you need the committee here to add such an amendment?
I am not aware of an amendment being officially offered.
Okay, but we know
Madam
that's
Chair?
what you.
Yes, ma'am.
With respect to the retroactivity, I did submit language to Senator Peters' staff. I don't know if it made it to the committee yet or not, but we certainly would like to see the bill reported out favorably with those two amendments.
So you want it back to March 1st, 2020, and to include also correctional officers. And if
Yes, ma'am.
those two things happen, that's the amendment that you want. We'll have to take a look to see if it's all here or not.
Excuse me,
Okay.
Madam Chair, it's Lori Morris from Senator Peters' office. We have not yet submitted the amendment, but did intend to.
Okay, all right, that's helpful to know. All right, we now go into the unfavorables. Nancy Egan.
Madam Chair, this is Jim McAllister. I believe I signed up on that bill.
Did I? I thought I called you. Okay, well, go ahead, Mr. McAllister.
Okay, certainly. Can you hear me?
Yes, I know you butted in to help us with something else, and that's how I checked.
Well,
All right, go ahead.
Anyway, we are in favor of this bill with amendments. Let me just say that one of the myths is that if it's not covered by comp, the medical expenses and the losses that these employees have and that these employers have somehow go away. They don't. The medical bills are paid by Blue Cross and Blue Shield. The hospitals whose bills don't get paid because people don't have the resources to pay them, they pass those along to the rest of us. So all of these bills, if they're not covered by comp, are going to be covered by somebody. And employers and small business owners who say, oh my God, my comp rates are going to go up if the one or two of my employees who got sick are somehow covered by comp, think about what's going to happen to their Blue Cross and Blue Shield premiums next year when collectively all of those employees out there who got sick caused major rates in those increased rates in those. So we approve of one of the reasons we recommend these presumption bills and we urge favorable approval is to make sure that the people who risked their lives, who went out and met with people, in a medical perspective or correctional officers, whoever risked their lives, at least we give them the benefit of the doubt. And if the doubt is disproven, then the presumption's rebutted. So we urge favorable approval. Thank you, Madam Chair.
But now, if I understand, you guys did tell us earlier that there had only been 6 such cases with the fire officers and so on in Maryland, did you?
Well, no. My understanding is there's one jurisdiction that's denied every one of them. So, and this is all word of mouth and rumor, but the bottom line is if you have a claim that you can't prove because you can't afford to hire the expert to prove it, why in God's earth would the insurance company accept the claim? It's not their job to pay claims. It's their job to pay claims they owe. They owe something if I can prove it. If I can't prove it, nobody's talking about all the claims we haven't filed, all the calls I've taken from emergency workers and nursing home people who say, I really think I got sick at work. And I say, how am I is it worth spending $1,000 to try and prove that your 2 or 3 weeks of lost wages are covered? So those are the people that this presumption bill helps the most.
Let's see.
Madam Chairperson, this is Matt Pavel. I too signed up to testify, if I may, in favor of this bill for the Maryland Association of Justice.
All right. Go ahead, Mr. Pavola.
Thank you. So I'll keep it really brief. One of the highlights that I would like for the committee to take a look at on this is that this has 3 elements, this bill, for these public safety officers to prove their case. First of all, they actually have to suffer from the effects of severe acute respiratory syndrome, coronavirus 2. That means they're really sick. They're really sick. So that objectifies it. Then they have to show that they had direct contact, as Patrick McAndrew pointed out, these public safety officers, that's actually an easy showing, but it's still a requirement. They're the ones that rush to the problems when the rest of us sprint away. So they do have that contact. And then thirdly and finally, it says the individual has been diagnosed with the COVID-19 or test positive for severe, I emphasize, severe acute respiratory syndrome, coronavirus, or severe acute respiratory syndrome. So it objectifies the standards. It makes it really rigorous. Not anyone who just tests positive will avail of this presumption that these public safety officers so richly deserve for the heroic acts that they take going back to last spring. Thank you for that opportunity to chime in, Madam Chairperson.
Okay, thank you. What about Carmine D'Alessandro?
D'Alessandro, thank you.
Yeah.
So, and I'm opposing, Madam Chair, so we crossed into the opposition.
What is that?
So we're now opposed. I'm opposing, so just make sure we've crossed into the opposition. There are no more favorable before I begin. So my name's Carmine D'Alessandro. I am Chief Legal Officer for Chesapeake Employers Insurance Company. Chesapeake is the largest carrier of workers' compensation in the state. We have about 22% of the market. In my position, I also oversee the state of Maryland workers' compensation program through IWIF. So we here at Chesapeake IWIF see about 1/3 of the activity in workers' compensation. You all have been talking about whether claims are being accepted or not, so I wanted to, and forgive me for looking down. So far in the last year, Chesapeake has received 791 first reports of injury for people claiming they sustained COVID at work. We've accepted 93% of those first reports. Another 103 people have seen fit to actually file an official claim with the commission. We've accepted 83% of those. So out of 900 people, we've only actually put 22 people to their proof. And we've had 7 of those individuals come up for hearing. We've won 3 and we've lost 4. So I know I'm crisscrossing bills, but if I could echo what Mr. Kress said in the prior bill, there does not seem to be a problem with the Workers' Compensation Commission addressing COVID-19. And one of the reasons is contact tracing. Unlike in other presumptions, for example, cancer, and the reason we have a presumption for cancer or heart disease, it's very difficult for that firefighter or police officer to say, is it the smoke from the fires causing my cancer, or is it the smoke from the cigarettes causing my cancer? And because that's such a difficult proposition, we tip the scales for them, give them a head start with a presumption. We haven't seen that issue with COVID-19. We have been able to trace back to work or non-work in almost every instance. And you can see from our numbers, if we're able to trace it back to work, we accept your claim as an injury. If we can't trace it, if we trace it to the bar or the airport, we deny the claim. And that's basically what we've been doing. And you can see we have accepted almost all of these cases because we can point them back to work. If we can't, and you've heard, I haven't heard yet of many issues in a particular county, in a particular occupation where people are not able to get their claims filed or get their hearings heard. So we think that, echoing Mr. Kress again, that there has not been shown any evidence that this presumption is needed. Other people are going to talk about various other aspects of the bill. Very quickly, I'd like to speak about retroactivity in a different vein from the insurance standpoint. Those of you, and you guys do a lot of insurance on this committee, you know that insurance companies, we set our rates and our premiums based on known risk. So when we charge our small businesses a premium, it's based on the risk as we know them. To retroactively apply a presumption a year ahead is having insurance companies assign and pay for risk that wasn't in the premium algorithms or rate algorithms when issued those policies a year ago, 18 months ago. So I echo what Mr. Enton said about retroactivity, but I would add that in, and I will stop there and pass to the next person, but we would respectfully request an unfavorable report on this bill. Thank you.
Thank you. We'll go to Michael Daly.
Apologize. Madam Chair, members of the committee, Michael Daly from the Maryland Defense Council. We
Can you
respect,
get a little closer to your mic?
certainly. Can you hear me now, Madam Chair?
That's a little better.
Okay. Michael Daly with the Maryland Defense Council, and we respectfully ask for an unfavorable report. I defer to Mr. D'Alessandro's testimony as it pertains to the numbers, which I think speak volumes. As Chesapeake, as you all know, is the largest insurance, workers' comp insurer in the state, and they're the ones really dealing with any cases that are coming up within this group of public safety folks. So I think those numbers really show that there is no issue with the handling of these cases in our state. Your commission is doing exactly what you ask it to do. Cases that are actually being tried are tried and are tried quickly. Decisions come out very quickly. Those cases that are compensable are found compensable. Our folks on the defense side found that the majority of our cases within primarily the private sector that we all deal with, as well as Chesapeake and the public sector, are compensable either by acceptance or those few that are tried are found compensable. The other issue with this bill that the Maryland Defense Council has is that it is thrown into the occupational disease arena. And as Ms. Murray so eloquently discussed at the last bill hearing, this is not an occupational disease. The commission, the few cases that are tried, are all being tried, to my knowledge, as accidental injury claims. So the reason why this is problematic, as well as the other reasons just established, is that the proof and the disability standard are different for accidental injuries and occupational diseases. In this case, disabilities in occupational disease claims that the injured worker must prove a disablement. In this situation, under this bill, there is no disablement requirement. So you're asking the commission to apply inconsistently the law by putting this into the statute. So at a bare minimum, the Maryland Defense Council would say this bill is unnecessary, but also if there's any consideration of it, it should be moved to a freestanding separate bill. And finally, that it should not be retroactive for constitutional challenges. That's going to raise a whole host of other problems that this bill is just going to invite. For these reasons, Madam Chair and committee members, the Maryland Defense Council respectfully requests an unfavorable decision. I'm happy to answer any questions you may have.
I do have one just following up.
Yes.
The final statements, no disablement requirement in this bill. But for COVID, might you simply have impaired lung condition, capacity, impaired heart capacity, impaired lymph node capacity? But from what I keep reading, which might not be what you would call a particular condition initially after you maybe have been hospitalized and try to return to normal, but it could be a lifelong impact on one's health, couldn't it?
Madam Chair, what you're describing is when a case would already have gone through the compensability process and litigation, and that person is claiming what they call permanent impairment. So that's at a later stage once a case is found compensable. For compensability analysis under our law, occupational disease must establish that there is disablement, and the law and the appellate courts have been very clear in terms of what that means. For example, they missed time from work. They were unable to physically perform their job duties. There's a variety of different things that the injured worker must show, because otherwise the commission would say that it's not ripe for consideration. And I think my respected colleagues on the other side would agree. If there is no disablement, the commission will issue an order finding that it's not ripe for compensability and disallow it.
I guess I'm asking if there isn't another operational definition of disablement then. If they can show from lab tests or from x-rays and CT scans that various bodily systems that are very important have all been impacted negatively and severely in ways that are going to be chronic for the rest of the person's life. no matter what they appear to be able to lift or to do the day after they have ended maybe hospitalization or something, wouldn't that be something that ought to be considered?
I agree with you, Madam Chair. And I think that's something that the commission would consider in terms of his or her analysis of the case before them. I think that is something that they're fully capable of evaluating and analyzing, and they already are.
But it isn't written somewhere as an alternative way of looking at disablement in the law and regulations.
Yes, and I think maybe you're pointing to there are other problems with this bill. It sounds like that there's missing components to it under your analysis.
Okay. All right, let's go to Nancy Egan.
Good afternoon. Can you hear me?
Yes.
Oh, great. Hi, my name is Nancy Egan. I am testifying on behalf of the American Property Casualty Insurance Association. APCIA members write 86% of the commercial workmen's compensation in the state. I will not repeat what my other colleagues have stated about the bill. I would just like to talk to two parts. One is the section on page 4 of the bill regarding testing. The standards we feel are inadequate. As Robert Enton testified on the prior bill, diagnosis should be defined as a positive PCR test for COVID-19, an incubation period, and symptoms and signs of COVID that require medical treatment. In my written testimony is the reason why we are behind a nucleic acid detection test such as PCR. In there, it talks about antibody test. And as we said before, this does not tell whether a person has a COVID-19 at the time of the test. A person with COVID-19 can test positive under an antibody test without having the disease. And we've already seen where antibody tests can have a high prevalence of false positive. Also, similarly, subjective diagnosis based on mere symptoms without a PCR test is not an accurate method of determining whether a person has COVID-19 under workman's comp. Speaking about the retroactivity, we've already mentioned that it would be very difficult now to go back and look at these tests, these prior claims, and now switch the burden for something that is currently being reviewed. And as Carmine D'Alessandro from Chesapeake has already stated, that they've already had 791 cases that they've reviewed, and 93% have been moved forward. In addition, it is very specific that there should be an end date to this presumption. As the state continues to open up, more and more people will be interacting with the public, and it will be very difficult to determine whether they had contracted the disease at work or when they're in their regular operations. So we would ask that the presumption should end if the body should move this bill within 6 months or when the state of emergency ends. Thank you.
Thank you. All right, did we hear from Robert Earlitson?
Unmute yourself.
Can you hear me?
Yes, we can.
Okay, okay. I unmuted myself. Okay, all right. I'm all set. I want to first of all adopt the written testimony that we've submitted, and also adopt the arguments that have been presented by other speakers, not only in this bill, but in the one other bill that I had the opportunity to listen to. I think the way you think about this bill is that it's an attempt to put a square peg in a round hole. The round hole that we're dealing with and have been for decades is the presumptions for occupational diseases, which by their very nature are slow and insidious in their development. That's why, for example, in this statute that's attempting to be amended, you have a 10 years of cumulative service for firefighters before they're eligible for any presumption for any of the various diseases that are listed in there. And I think 3 years for park employees for Lyme's disease. So there's a threshold that you have to work in, and by the definition of an occupational disease, it is slow and insidious in nature. That is not true with COVID-19. At least it's my understanding, and I think there's strong evidence that you get that from a one-time exposure for some 15 minutes with somebody who is infected and you get within 6 feet of them. That's a one incident claim. And that's why the commission has been treating this as an accidental injury. So I think it's wrong to be putting what is by its very nature a singular event into an occupational disease statute. The other concern that I have is the level of proof necessary for an employer to rebut this presumption. In effect, the employer is by this passage of the statute is supposed to be proving a negative. And that, of course, is extremely difficult here by the way this statute is worded. You establish that the claimant is in this certain class and that they have tested positive for COVID-19. Bing, they prevail. There's no evidentiary standard incorporated in the statute to establish by how an employer can prevail, and by for practical effect. In already existing cases in this statute, it's nearly impossible for an employer to prevail. And to make this now retroactive, that is like trying to put the proverbial toothpaste back in the tube and have all of these potential claims that employers have no idea whether they're making a claim or not, now could suddenly become compensable. And I think that that's terribly unfair for particularly self-insured employers, but also insurance companies attempting to charge reasonable, fair rates to their insured. So we would respectfully ask for an unfavorable report, Madam Chairwoman.
Yeah, I got one quick question, and then I'm calling on Senator Battle. I think I saw her hand. If the current statute is not about something like COVID that you could get in a few minutes of exposure, and it deals with occupational diseases that are gotten because of continuous exposures over a period of years.
Right.
That would leave persons who in fact could get COVID in the course of dealing with evacuation of a burning building or something, with nowhere else to go. Can you work with the sponsor or with someone to figure out what ought to be there for someone who in fact could be demonstrated to have gotten COVID and had significant harm done to their bodies because of it, not because of your occupational disease definition operationally, but because of this other circumstance that could be just as devastating or more.
And I think you've just made an excellent case for an accidental injury. Because if you're in a burning building and the person is exposed to individuals who are positive for COVID, that's an accident, particularly if they contract that problem there. So you should be taking Mr. McAllister's place and then making an excellent argument that is a compensable claim.
Okay, thank you. Senator Battle.
Thank you, Madam Chair. I actually have a question for Mr. D'Alessandro. We heard earlier about needing some kind of a causation report. Do you find that a causation report is needed for compensability?
We have not found that to be the need in COVID cases because it goes back to what we've been harping on, the accident versus a disease. If you have something like lung cancer or heart disease, absolutely, you need a doctor telling us where he or she thinks that disease came from. But take an accident. If you get hit by a car and break your leg, I do not need a doctor telling me that your leg is broken because it got hit by the car. That's pretty self-evident. So with the contact tracing, once we get it to the employment, we no longer, and a positive test, we no longer need it. We're not requiring it. And I know we've actually lost a couple of cases at the commission when the other side didn't even have a medical. So the medical, it's in comp diseases, yes, you would need a medical because they're called complex medical questions. For an accident, you fell down the steps and broke your arm. I know how you broke your arm. I don't need a doctor reinforcing that. So I would respectfully disagree that these medicals are needed. And like I said, we've lost several cases when the other side did not have a causation report.
Thank you.
If I could interject here too.
But we're not going to be, now we still have 8 bills.
Just very quickly. mainly
But we
because-
would appreciate from any of you, if you want to send us back a note telling us what else you didn't have time to tell us today, and send it timely so we can get it into the record and consider it before there's any voting on this bill. It's very important legislation. And we've heard good testimony on both sides. Okay, thank you. All right, we're going now to Senator Carter, Senate Bill 756. Senator, you have whatever time you need to lay out the parameters of your bill. You have indicated that Scott Goldstein will be your chief proponent witness. That person will get 5 minutes, and all of the other witnesses on your bill will have 2.5 minutes. Okay? Senator
Thank you.
Carter? Yes.
I'm here. Thank you, Madam Chair, and thank you for listening to this bill. You have your hands full today, members of the Finance Committee, and you are hearing a lot about this issue regarding our sheroes and heroes that are frontline workers in Maryland that have put their lives at risk throughout the course of this pandemic. And so this is yet another bill similar to others that you've heard that would create a presumption. I got a chance to listen to the end of the last bill sponsored by Senator Peters, and I heard something about an amendment, but I would just point out that my bill does have retroactivity embedded in the bill, and that is essential to the bill because without that, we wouldn't be able to cover people that need to be covered that were harmed during the pandemic. Also, another distinction between this bill and the other bills is those that are considered frontline workers who would actually be covered. And I would leave it to the wisdom of the committee to make that determination, although my bill outlines a list of frontline workers that have been deemed as such in other legislation. I think it's imperative that Maryland join 20 other states that have already taken initiative to pass this type of legislation. I think that we must do something to make sure that our frontline workers are protected and that they are covered. And why is a presumption necessary? Well, this is hardly groundbreaking because, as you know, we already have presumptions in law, and we have them in cases where there are unusual hazards. And there's no argument that COVID-19 presents such a thing. And so with that, I'm gonna stay in your good graces, I hope, by ending my presentation and deferring to my lead witness, Scott Goldstein, and very, very proud to say that my other witness is my former chair and Senator Bobby Zirkin. Thank you.
Okay, thank you very much. All right, we'll go now then to Mr. Goldstein. You have 5 minutes.
Good afternoon, Madam Chair, members of the committee. My name is Scott Goldstein. I've been practicing law on behalf of injured claimants, plaintiffs for the last 38 years. My role is as the Director of Litigation at Science & Kirk, a local plaintiffs law firm. I'm also one of the lead managers at that firm. We have an opportunity to see many, many cases come across our desk over the course of the years. And one of the things that is clear to me is that the presumption that is proposed by this bill is not only warranted and justified, but it is long and hardly deserved by the people that would benefit from it. These are first line workers. They are public safety people. They are healthcare workers who do not ask before they enter into a dangerous situation. They do so out of a sense of duty. They do so out of a sense of responsibility, and they incur risks inherent with their work through no fault of their own, placing their own lives and safety at risk. And as a result of it, they deserve to be protected. They don't get to ask those questions. It's been said before that, well, they'll be covered by an accidental injury claim rather than an occupational disease. But the truth is that a firefighter or a paramedic or someone who works in an emergency room comes in contact with many people during the course of an 8 or a 10 or a 12-hour, or in this day and age, even 18-hour shift. If you consider each exposure to be an accidental injury, you're playing into the hands of insurers who could then argue that each case should be divided and apportioned when you come down the road to any degree of permanency. And that's really an unfair burden to place on these people. They are coming in contact with a unique disease that the we have never seen before anything like this, where the scope of it is so wide ranging and it is so unpredictable as far as the manner in which each individual person is affected. There's a big difference between this and cancer. There's a big difference between this and heart disease. Some people contract COVID and it's mild and they're over it in a week, 10 days, 2 weeks, and they suffer no permanent consequences as a result of it. Others, however, are left significantly disabled, the long haulers. We don't know enough as we sit here today about the long-term effects that this disease is going to have on people. We should not wait and have to go back retroactively to discuss it. Many of the arguments against the retroactivity aspect of this bill say that it's unfair to place this on employers. It's unfair to do so. Well, it's unfair to the first line workers not to give them this protection. If these are accidental injuries, the way that the law works currently in the state of Maryland, an employee has up to 2 years after the occurrence of an accident or the filing of a first report of injury by the employer to be able to make a claim and be within the appropriate statute of limitations. We're talking about retroactively going back to just about a year ago. So we're not breaching any new ground here. We are not trying to expand the limits of what otherwise would be compensable claims. We are merely trying to shift the burden in favor of the employee so that they do not have to prove causation, so that it is instead presumed. That is a big burden. As Mr. McAllister said earlier, there are many cases where the employee will not be able to bear the cost. And as a practical matter, the law firms that represent them will not be able to justify the investment of the money that would be necessary to be able to conclusively prove that their exposure came in the course of their employment. So to do that, to shift that onto the individuals, I would suggest to you is unfair, unjust. It's simply not the right thing to do. These people have stepped up. They have served out of responsibility. They serve. Where would society be today, now, if front care workers, healthcare workers, and public safety people refuse to perform the duties that they've been asked to perform over the course of the last year because the risk was too great to them? We're not rewarding these people. We are giving them what they have justly earned. By giving this presumption in their favor, you are shifting the responsibility. If anyone can bear the cost of investigating the issue of causation, it's an insurer more so than an injured individual. These people are missing time from work. They are in need of medical care. And some of them are going to be left with permanent problems that will impair their ability to earn a living for the rest of their lives. For those reasons, you should report favorably on this bill, and this presumption should be accepted and passed.
Thank you very much. We're going next to Senator Bobby Zirkin, who will have 2.5 minutes.
Well, good afternoon, everyone. It's great to see all of you. Really good to see all of you. And Madam Chair, it's nice to see you with a gavel. You look great. Thanks for I wasn't going to testify on this. I'm really proud. I'm just doing a little bit of government relations work, and I'm really proud working with Science and Kirk, who you just heard from. And I was just going to sit here and listen, but I decided I wanted to testify on this bill. Just from a personal standpoint, as many of you know, you've met my brother, who is an emergency room physician, who every day since this started walked into the emergency room, panicked, quite frankly, and coming home to a family who was panicked and absolutely took his life in his hands every single day, and did develop COVID at some point. Did nothing except for go into the emergency room and back. And thank God it was a mild case. My brother-in-law was not so lucky, developed COVID, also what it seems like through employment, and ended up passing away a few weeks ago. So I wanted to testify personally on this bill. In addition to it being important, just all these people that we gave applause to and said great things about on Twitter and Facebook and all the rest. This is a complicated issue, obviously, of presumptions. You're not breaking any new ground here. There's an article, and if you just Google NCSL COVID workers' compensation, you can see a list of what every state has done, and states from Alaska to Arkansas to California, New Jersey, Minnesota, all of them have done something. Not all of them have done this. You have 5 separate bills here that all do, somewhat different things. I thought Senator Carter's was really good, but I listened to the other ones and Senator Klaus Meyer's looked good too. They're all pretty close. I do think retroactivity makes sense because, quite frankly, most people got sick at the beginning of this thing. And if you're interested in the numbers, I know Senator Bidel asked about numbers. There was an executive order that the governor did right at the beginning of this thing, mandating that all of the insurance companies track these numbers. So you can get these numbers from the Maryland Insurance Administration. I'm not saying that what Chesapeake said was untrue. I have no way of knowing, but there's an article in the Wall Street Journal just a few weeks ago that talked about the percentages of claims that were being denied nationwide, and it was somewhat around 50%. So, and they were, hundreds of thousands of cases. So for Chesapeake to say they had 700 and that they were all accepted, I'm not saying that they're wrong. I'm just saying that would be the complete outlier for the rest of the country. So anyway, I just wanted to come and see you and see Senator Kramer's new goatee, which I heard so much about. And just wanted to say thank you all for all your work you guys have been doing this year. It's incredible. I can't imagine being there and in the position you all are in with masks and not being able to socialize. So thank you for your service and thanks for hearing me out. It's good to see you all.
Thank you. And we will follow up with the citations provided by NCSL. That's always a good source. Okay, let's go next to Matt Calbola.
Thank you. Thank you, Madam Chairperson. What a stirring presentation by Mr. Goldstein and even more so by former Senator Zirkin. Almost gives you goosebumps, just as you see, we've all seen those signs at hospitals now. These are the heroes. These are the heroes, these first responders, the public safety officers and these healthcare workers. And it's hard to imagine that they're getting this much opposition today. I'm surprised that we would want to fight these first responders who rush into harm's way and have been doing it ever since last March and continue to during this pandemic, a pandemic that knows no answers. This bill, the Maryland Association of Justice is proud to favor and ask for a positive response from this committee. It does add these healthcare workers to the public safety officers. I do note, unfortunately, does not include correctional officers, and it really should. But otherwise, this is an admirable bill. And can I point out that it actually fortifies the standard for healthcare workers? It makes it a little more difficult for them. Not only do they have to show what the public safety officers have to show, but they have to prove at their hearing to enjoy this presumption in front of a Maryland Workers' Compensation Commissioner that they were in direct contact with patients or they helped occupy, clean, or repair areas occupied by patients, meaning COVID patients. Dangerous stuff they do, and they deserve this protection. Let me say one other thing too that keeps coming up. The Maryland Association of Justice is not concerned with, do we call this an accidental personal injury or do we call this an occupational disease? Both of them have the same limitations period to file within 2 years. And it does resemble, we would tend to agree that it's triggered by an event. And we're fine either way. The importance is that something be advanced. And I can tell by your reaction today, Chairperson Kelly, you realize just how important this is. And we just would ask, please, for a favorable rendering on Senate Bill 756. Thank you.
Thank you. All right, we're going next to James McAllister. This is favorable with amendment.
Yes, Madam Chair, can you hear me?
Yes.
One of the things you get to do when you're sitting on these Zoom calls and you're not up is Google things. So Maryland has a large number of deaths as 8,000 deaths as a result of COVID. 388,000 people have tested positive. So when you look at the statistics from the Maryland Health Department, between the ages of 20 to 59, 252,000 Marylanders, we'll call that working age, have tested positive. The CDC says approximately 1/3 to 40% of people who test positive are asymptomatic. So, and they say another 20, 30, 40% don't experience serious symptoms. So what we have then is out of 252,000 people, we've got almost 100,000 people who've got symptoms, yet haven't filed comp claims. And that's for one of two reasons. Either they didn't get exposed at work, or they got exposed at work and they can't prove it. So there's been no rush to file these claims, because when people call me saying, I want to file these claims, unless it's absolutely crystal clear, like I have a nursing home worker who worked with a COVID patient and got sick right afterwards. And that's why the insurance companies are seeing the low hanging fruit. They're seeing the easy to accept claims. But the fact that they're accepting some of these claims at such a high rate doesn't mean that we don't need the bill for those that they're not accepting. And once there is a presumption, they're going to get more claims. They're going to get the claims we're not filing now, because it simply doesn't work. And you do need a medical. I can tell you more often than not, I go there, I don't have the medical report, the commissioner throws out my claim. So that's what you need to win. And the other thing I want to say about Mr. D'Alessandro is he answered Senator Hershey's question, which is, how do you investigate and contract tracings? He said that's what they're doing. So they're doing it now. They're doing exactly what we told you the insurance companies do. So they're not at a disadvantage as a presumption. They're merely incentivized to do their research, keep their records, and keep their people safe so they can prove or disprove that the people got it at work. Thank you.
Thank you very much. Are we going next to number six? James Lanier.
Thank you, Madam Senator. Yeah, I think Mr. McAllister and I need to start switching up our names. One of us got to go by a middle name or something. I'll be honest with you, ma'am. Senator Carter, my issue is retroactivity. Senator Carter's got it. I really don't have anything else besides me too on the retroactivity issue with regard to Senator Carter's bill. Thank you.
Okay. All right. Carmine D'Alessandro, unfavorable.
Thank you, Madam Chair. Again, Vice Chair Feld, members of the committee. Hopefully you'll indulge me by crisscrossing bills and adopting the opposition for the other presumption bills, since it's pretty much standard. I don't want to repeat any of that testimony. So I'll adopt all the unfavorable testimony on the prior bills. I would just like to point out, because I don't want there to be a misconception, if this body were to do nothing and not pass a single one of these bills, anyone who alleges that they became positive at work going back to March, under current law, you have 2 years to file your accident claims. So even if this body decided no bill is needed, anyone who has been holding on to their claim, and I don't know why anyone would hold on to a claim, has another year under current law to file. So if I don't want to be a misconception, if you do nothing, the people who didn't file are now out of luck. They still have a year to file their accident claims. And as for the numbers, obviously, I always stand by my numbers, but yesterday we had a call with Chairman Allman, who indicated there are about 1,000 claims at the commission right now. And I'll try to get the percentages, Madam Chair, to see of the 1,000 that we know are down there, the acceptance or the compensability rate. So you have that number. I don't have that number with me, but the chairman of the commission did say yesterday there have been 1,000 down there, and I will try to get the committee those statistics so you can see how these cases are actually being decided, and have that for your file when you review the bills. And with that, I will ask for an unfavorable report and allow you to move on.
Thank you very much. We're going next to William Kress. Is Bill Crest still available? Okay, then we'll go to Jabin Drew, Drew Jabin. I'm sorry.
Thank you. Chair, Vice Chair, members of the committee, again, for the record, Drew Jabin on behalf of the Maryland Association of Counties, here in opposition to Senate Bill 756. As always, you have my written testimony. I will be brief. You've heard from all the other unfavorable witnesses, both on this bill and other similar bills today, and will continue to do so. I can't really say it better than them. I would just like to note that, as stated in the fiscal note, counties employ quite a large number of essential workers included in this bill, meaning that there will be major fiscal impacts for local jurisdictions, especially due to the retroactivity of this bill, and accordingly make a request an unfavorable report on Senate Bill 756. Thank you.
Could I ask if MACO is already involved with a number of cases that might have been filed?
I personally am not aware.
We have county information.
Do you know anything more that you could tell us about? I mean, we all live in some county, about the bases of their.
So I don't have any information handy, but I'm happy to get that information for you.
Okay, thank you.
Of course.
All right, and then finally, Nancy Corson.
Good afternoon, can you hear me?
Yes.
Good afternoon, Chairwoman, Vice Chair, and members of the committee. My name is Nancy Corson Cook, and I've been representing employers and insurers in workers' compensation matters for 25 years. Today, I come to you representing the Maryland Chamber of Commerce in opposition to the inclusion of any private business in these presumption bills. You may not know, but the presumptions that are already established in the workers' compensation statute are only with public service and public service employees. Any of the bills that are before you today that indicate an inclusion of private business, the Maryland Chamber is strongly opposed to. As you know, in addition to illness, one of the huge problems with COVID in our economy is the impact on business, especially small business. A lot of your efforts to encourage employers to expand benefits to employees are already being implemented by businesses, including family, medical, and leave, sick and safe leave, increase in the minimum wage, additional protections for employees during times of crisis, and increased costs in unemployment, experiences, taxes, some going up as much as 700% on our businesses. One thing, though, that you all build into those other bills is a protection for small business, because a lot of those bills do not apply to employers with 50 or less employees. In workers' compensation cases, though, you're throwing the small business people in with the large business people. The claims costs and the defense costs are the same. And remember, 80% of small businesses are less than 20 employees. And many of our small businesses are women-owned, Black-owned, and minority-owned businesses. In fact, 1/3 of all Black-owned businesses in this country are healthcare industry. So these presumption bills, if you push them out into the private sector, will disproportionately impact many of our small businesses and minority businesses. The Workers' Compensation Commission is already adjudicating these claims. We ask that you allow them to do what they do well, and we ask for an unfavorable decision on this bill. Thank you.
Thank you very much. Okay, that ends the testimony on that bill. We're going next to Senate Bill 812, Senator Klossmeyer.
Thank you, Madam Chairman. Everybody has seen the movie Groundhog Day. That's where I feel like I am right now. I have two bills and they're pretty much the same. Senate Bill 812, it's workers' compensation, occupational disease presumptions, COVID-19. And I just want to add, the reason I have these two is because as the chair of the Oversight Committee, I always just say, please, anybody that wants me to put any bills in, I will put them in for either side or whatever. So And I also would just like to add that anyone that has a bill in, if they have any amendments or any thoughts on their bills for this, please to let me know. And I didn't say unemployment, did I? Workers' comp. They both come out of my mouth. But anyway, Senate Bill 812 grants a workers' compensation presumption for firefighters, paramedics, police officers, correctional officers, and healthcare workers for contracting COVID-19 while on the job. These employees are always on the front line when it comes to keeping our community safe, and it's important to provide protection should they become ill. In order to receive workers' compensation benefits, the employee shall provide a copy of their positive test to their employee or their employee's insurer. The date of eligibility for benefits will be determined by either the first date that the employer missed work due to symptoms or positive test result, whichever occurs first. The employee is not precluded from claiming an occupational disease or personal injury. The employer or insurer may rebut the claim if they can prove that employment is not the cause of contracting COVID. This bill would apply retroactively to any claim filed after January 1st, 2020. The notice requirement is a year from when the employee tests positive or receives a diagnosis, and the timeline to fill with the commission is 2 years. With me today, I have Matt Pavala, James Lanier, James McAllister, who can speak to the importance of granting this presumption. I thank the committee for their consideration of Senate Bill 12 and ask for a favorable report. Let me just say, we had the first meeting of these bills yesterday with the Oversight Committee, and I have asked that all of those in favor, all of those not in favor, get together and try to come up with some language so that we can move these bills. But I don't know if they have, and I have said at the end of the week, we will sit down and talk some more. But I'm hoping they're working together as we have always done with workers' comp bills to try to come to some kind of conclusion. So with that, that was Senate Bill 812, and would, okay, and
Okay.
let,
Well, you still
I mean,
have
they can,
several other
everybody
people
can
to
talk on both
testify.
of these bills.
Okay, let me have all the people, all your witnesses, at least tell us why they are for or against or with amendments, and then we'll go to the other bill.
Okay, because they're saying the same thing. Okay, I don't know who's first.
So I believe I'm first. Matt Pavel is speaking, and I didn't quite hear the chairperson's request. What was that request, please?
Just why you're for or against, or whatever your position is. This bill.
Okay, very good. So Senator Klaus Meyer, thank you for permitting me to do lead on this on behalf of the Maryland Association of Justice, and we are for. We're definitely favor this bill and ask for a favorable committee response to Senate Bill 812. This is, I thank you for standing in the gap that way, Senator Klaus Meyer, and always being willing to hear from both sides on important issues. None that we've ever approached you in recent years is as important as this. I think I've neglected to thank Senator Carter for the prior bill, which resembles this in many ways. She too gave a stirring presentation of why we need to protect our public safety officers and our healthcare workers. Thankfully, this bill does include correctional officers very specifically, so it does not need any change along those lines. And like the other bill, what makes this so good is not everyone can avail of this presumption. You have to show that it happened at work, that you had the contact. The injured worker has to show that. It's an excellent bill from that point of view. It also is excellent because it objectifies the injury. Not every COVID-19 positive response, especially those rapid test responses, will result in use of the presumption. You have to show suffering from the effects of, again, that severe acute respiratory syndrome. That's a very huge standard. And of course, have a positive COVID-19 test or the antibodies of severe acute respiratory syndrome. That's very important. As indicated, those two categories of persons who are protected are healthcare workers and public safety officers. If I said any more, Madam Chairperson, I'd be repeating what was previously said, and we don't want to belabor it other than to say we truly and enthusiastically support this particular 812, and we're so grateful for the opportunity to submit this testimony on it. Thank you so much.
Thank you. We'll go next to James Lanier. It's favorable with amendments.
Thank you, Madam Chair. With regard to my, again, we're adopting what I've said before on the other bills. With regard to my issue of retroactivity, this bill does go retroactive if passed January 1st, 2020. It certainly would cover all of the periods that we've already discussed. With regard to the issue of retroactivity, I don't have anything additional beyond what has already been said.
Okay. We'll go then to James McAllister.
Madam Chair, can you hear me?
Yes.
First of all, I want to echo what Mr. Pavla said. If every one of these bills, with the exception of the first one we took up, says the individual is suffering from the effects of severe acute respiratory syndrome, coronavirus 2, that the inclusion of that wording means that it walls out anybody who tested positive but was asymptomatic. So for instance, if you got sick and if you didn't get sick, but your employer said you have to quarantine, the presumption doesn't apply to you. The second thing I want to say is, and thank Senator Klausmeier always for her kumbaya leadership among a bunch of lawyers and stakeholders who will have to disagree on what we have to disagree on. But I've already reached out to some of the stakeholders who are on this Zoom to discuss those areas where we can, I think, reach some common ground. Accidental injury, occupational disease, I think we can fix that. The specific type of testing that Mr. Anton brought up, I think we can fix that. So I think we can tweak and solve the technical problems so that the perfect is not the enemy of the good. Thank you.
Thank you. All right, we'll go next to Melissa Bragg.
Chairwoman Kelly, thank you. Again, I'm Melissa Bragg, and I'm representing the Professional Firefighters of Maryland, and we are favorable with amendments regarding Senator Klausmeier's bill, Senate Bill 812. It contains language regarding the manner in which the presumption created by the bill may be rebutted. However, the language is not necessary and should therefore be removed. In Senate Bill 812, page 5, lines 13 through 15, we would like to remove the rebuttability of the presumptions. We believe as it pertains to the firefighters and paramedics across the state, it is not necessary to include an additional definition of rebuttability on the presumption. This was done by the Maryland Court of Appeals in the city of Frederick versus Schenkel in 2001, and it is 20 years of standing case law that has protected firefighters and paramedics and defined the parameters of the rebuttable presumption. We want to make sure moving forward, we continue to follow the 20-year case law as associated with firefighters and paramedics, and don't get that mixed up with any other definitions that might apply to any other professions or other career fields. Again, we want to thank Senator Klausmeier for her support, and we are favorable with amendments for Senate Bill 812.
Okay, thank you. What about Robert Enton?
Thank you very much, Madam Chairman, members of the committee. Robert Enton on behalf of the American Property Casualty Insurers Association. And frankly, I mean, it's been, I don't know what, an hour and a half, I think, since I testified earlier on Senate Bill 860. But my points are basically the same. The points that I want to make are that we think that these bills should not be retroactive. It's very, very rarely that we've made any bills retroactive. In fact, most of the time, I think we've done that. As some members of the committee will recall, those bills are found to be unconstitutional when you apply them retroactively. Because it just doesn't make sense. I mean, you guys pass bills and they deal with, we don't go ahead and pass something and say, even though this wasn't the law back then, you're now subject to it. The same thing I'll make the same comment about the testing, and Ms. Egan made this in her testimony. We think the testing needs to be real testing which shows and supports the condition, not the testing described. And those are the main points, and I'd be happy to answer any questions, but I think all these bills have kind of a common theme to them and a common concern on the part of our industry, which represents employers. And I think if we could work those things out, it'd be our great pleasure to support Senator Klausmeier.
Okay, Carmine D'Alessandro.
Thank you, Madam Chair. Members of the committee, again, I will adopt all the testimony in the prior bills in opposition, since all these bills are similar. I do want to make 2 points. One, in response to a question you had, Chair Kelly, about counties. Obviously, I don't have Mako, but Chesapeake and Shores, 9 counties, Culvert, and then 8 on the Eastern Shore. We've accepted 93% of the claims coming in from counties, which would have been sheriffs, correctional officers. Most of the counties are municipal, so municipal employees. And I do think it's interesting because many of you have asked about denials and what's happening at the commission. And to my knowledge, I've given all my stats. The only person that's talking about the few that are denied is me. There's been no evidence presented before you of any group, any occupation that has not been able to avail itself of the commission. Every time you've asked about denials, I've heard that no one is aware of any or inappropriate denials. So again, there's really been no testimony that justifies why we need this based on what's actually happening. I echo what we said yesterday in oversight with Senator Klausmeier. I'm very proud of the way the Workers' Compensation Act and community has responded to this, because people are still getting in-person hearings while other courts are closed. The commission's been open since June. Hearings are going forward. They are open full-time for business, and these claims are being processed. So with that, I do thank Senator Klausmeier for their leadership on oversight, along with Senator Feldman. I appreciate that they are always introducing comp bills so we can have these conversations, but I will respectfully oppose these two as well, ask for a favorable opinion. And yes, Senator Klausmeier, I do owe Mr. McAllister a call, but we are talking on several points. I'd like to say we're close. I don't think we are, because there are a couple big points, retroactivity and what groups will apply, that are going to be the sticking points. But we are talking, as we always do in the comp community. Thank you.
Thank you. Robert Enton. Oh, did we hear from him? All right, Drew Javin.
Thank you, Chair, Vice Chair, members of the committee. Again, for the record, Drew Javin on behalf of the Maryland Association of Counties, here in opposition to Senate Bill 812 and along similar lines 813. As always, you have my written testimony. I would just like to second what other unfavorable witnesses have said, and again would like to note the fiscal note. As stated in the fiscal note, counties employ many of the workers included in both of these bills, meaning there's the potential for significant fiscal impacts for local jurisdictions, especially under Senate Bill 812 due to the retroactivity, and accordingly Mako requests an unfavorable report on both 812 and 813. Thank you.
Thank you. And finally, Nancy Corson.
Good afternoon again, Nancy Corson Cook on behalf of the Maryland Chamber of Commerce. Again, the Maryland Chamber of Commerce is strongly opposed to any presumptions that extend to the private sector, including childcare, essential workers, and healthcare workers. Specifically, those categories are extraordinarily broad, and the definitions of those categories are extraordinarily broad. Extending presumptions and putting your thumb on the scale for injured workers against businesses will disproportionately impact small business. Small businesses already having terrible impact on their revenue and their capital and their access to capital because of the COVID crisis. And placing this additional burden on them is inappropriate and unfair and has not been done before. All presumptions and workers' compensation claims are public sector only. Thank you.
Okay, thank you. We're going next to Senator Klostermeyer's Senate Bill 813, Workers' Comp Occupational Disease Presumption COVID-19. And Senator, after you open up for us with the parameters of your bill, we'll go to Kimberly Reed, who's your main proponent.
Okay.
5 minutes. Everybody else will have 2.5.
Okay, thank you, Madam Chair and members of the committee. And again, it's like Groundhog Day. Senate Bill 813 grants a workers' compensation presumption for firefighters, paramedics, police officers, correction officers, security counselors, child care workers, education workers, healthcare workers, and essential workers who contract COVID-19 while on the job. Similar to Senate Bill 812, these employees are on the front lines on a daily basis, and they are most certainly entitled to protections if they should become ill. In order for the employee to receive workers' compensation benefits, they must have duties that have required them to work outside of their home within 14 days of developing symptoms. The employee shall provide a copy of their positive test to their employer or employer's insurer. The date of eligibility for benefits will be determined by either the first date that the employer missed work due to symptoms or a positive test result, whichever occurs first. The employee is not precluded from claiming an occupational disease or a personal injury. The employer or insurer may rebut the claim if they can prove the employment is not the cause of contracting COVID. This bill would not apply retroactively. With me today, I have Kimberly Reed, Daniel Udoff, and Rosemary Wentz, who will explain the importance of granting this presumption. And again, we've heard these bills over and over today, and I just hope that we can all work together on these and get them through. So.
Thank you.
Thank you.
We're going then to Kimberly Reed, your main proponent.
Good afternoon, Chair Kelly. Can you hear me?
Yes.
Good afternoon, members of the Senate committee. My name is Kimberly Reed, and I'm here actually on behalf of my sister, Teresa Lehman, who could not testify today as she's still recovering in a rehabilitation facility from contracting COVID-19 at her workplace almost a year ago. She's known as a long hauler. And we ask for a favorable report on SB 813. As you have heard already from representatives from lobbyists from the lucrative insurance companies who argue that this bill is not necessary because current processes work. My sister's case, in which management at her job terminated her while she was in a drug-induced coma from COVID-19 and was denied workers' compensation, proves otherwise. In March of 2020, my sister, who has been employed at Patuxent River Health and Rehabilitation Center, came into contact with residents and other staff who contracted COVID-19. The initial response from management was to give employees a surgical mask with directions to make it last for a week or wear it until it falls apart. Other forms of PPE, hospital gowns, hazmat suits, face shields, etc., were hardly ever used. And when they were used, hospital staff were told to reuse them frequently or even asked to wear patient gowns to protect themselves from the virus. Within a month, my sister tested positive for COVID-19. After a month on a ventilator and nearly 2 months of intensive therapy, she was finally able to come back home. However, she had learned that when she was on the ventilator on May 11th, management terminated her position. Technically, management of her job said she voluntarily quit her position. But again, she was on a ventilator in a coma, so she couldn't voluntarily resign. Members of the committee, what has happened to my sister is what is happening and can happen in the future to any Marylander who tries to emerge from this pandemic. She, along with other essential workers, have been in the front lines of the war against COVID-19 for over a year and counting. Please do not force them to fight two fights, one against the virus and one against bosses of the well-to-do insurance companies who deny workers' comp benefits just to maintain their bottom line. I again ask for a favorable report on Senate Bill 813. Thank you.
Thank you very much. All right, we're going next to Daniel Udoff. You have 2.5 minutes. Is Daniel Udoff still here?
Don't see him.
Okay, we'll go to Rose Wirtz.
Good afternoon, Chair Kelly. Can you hear me?
Yes.
Fantastic. Well, good afternoon, Chair Kelly and members of the Senate Finance Committee. I'm Rosemary Wirtz, Field Coordinator for AFT Healthcare Maryland. We're the labor union representing healthcare professionals in Maryland state government. We thank you for the opportunity to speak in support of Senate Bill 813. Many of our members have been reassigned to duties related to the COVID-19 response. They're engaged in screening, testing, contact tracing, and vaccinating. A year ago, there was little information available about the spread of COVID-19, but that has changed. Now the Maryland Department of Health is tracking individual strains of the virus. As an exclusive representative for a unit of state employees, we meet with management on a regular basis to resolve issues at individual state facilities. In the last year, our discussions have centered around the pandemic. During these meetings, a repeated request for access to the information about the spread of the virus within the facilities has been denied. Even more worrying for our members has been the state's statements about how employees are exposed to the virus in the community, at the gas station, or at the grocery store. We need this bill because employees do not have access to the information about the spread of COVID-19, not even our employees that are gathering this information. They should not have the burden of proof under these circumstances. Management's repeated response to our members' concerns regarding exposure to the virus at work has been that employees are exposed outside of work. A nurse should not have to prove that she contracted the virus while working 60 hours a week on a quarantine ward, rather than during the 10 minutes she spent outside with a mask on, putting gas in her car to get to work. It's just ridiculous. But that's the response we're getting from management. So for these reasons, we respectfully request a favorable report for Senate Bill 813. Thank you for your time.
Thank you. All right, I think we see Daniel Udoff now, so we'll go back to Mr. Udoff. You have 2.5 minutes.
Thank you, Madam Chair. And I apologize for the technical difficulties. Good afternoon. My name is Daniel Udoff. I'm an attorney with the law firm Conn Smith & Collins, and I want to thank you for your time and consideration of this critical issue today. Opponents of this bill, I've heard argue that it would create an environment where if you've got a job and you contract COVID, then you've got a workers' comp claim. I've heard them assert that the presumption will make it impossible for employers to defend these claims, that their burden would somehow be insurmountable, and that the system would be overrun by new cases. These arguments are not supported by history, however, and don't accurately reflect our experiences with existing similar laws. Presumptions, simply put, allow common sense and general knowledge to be factored into the legal analysis. By definition, they are rebuttable, and employers have always had the wherewithal to defend against these types of claims, often successfully. That is the reason that not every police officer wins a hypertension claim, or every firefighter wins a cancer claim. It's because irrespective of presumptions, claimants are still not alleviated of their evidentiary obligations. They are still required to meet a threshold of proof, including definitive diagnosis, supportive fact pattern, and a causal relation opinion, which must be proffered within a reasonable degree of medical certainty. These workers in many ways serve as the backbone of our society and economy. They do the work which many of us either can't or won't do. They put their health and safety on the line to support their families, and because they do their jobs, it enables the rest of us to do ours. Each of us takes risks in one form or another in our home lives, called personal choice. But it's different when the situation is professional. Workers can't always make their own decisions. They can't choose with whom they interact, can't always socially distance, and can't force people to wear masks appropriately. Most importantly, they have to rely on others to make considerate and responsible decisions for themselves, which unfortunately too often is not the case. These inherent hazards of employment are part of our present day reality. The benefits available through workers' compensation are irreplaceable. They create a framework for protecting employees and must evolve when exceptional circumstances dictate. This pandemic clearly falls within those parameters, and the legal presumption being proposed today is not only appropriate, but it is essential. Thank you for
I
listening
hate
to
to
my
butt in,
testimony
but we're
and
going
your hopeful support
overtime.
of this bill.
Okay, thank you. Okay, we're going to James McAllister. Favorable with an amendment.
Certainly, Madam Chair, can you hear me?
Yes.
Okay, the nice thing about this bill is that it includes essential workers. And essential workers are people who are covered by the governor's order who are required to work outside the home. These are people that can't phone it in. These are people that stock the shelves in grocery stores. And those of us who tried to buy toilet paper back in March and April know what it's like to see an empty shelf. So those are the people that left the safety of their home in harm's way. These are the bus drivers that drove the nurses around, that delivered employees to work in retails and warehouses so that our shelves would be stocked. These are important people to be covered by the presumption. The main argument I'm hearing is that the insurance companies really aren't denying these claims, so we don't need a presumption bill. Well, you got to understand the dynamics of insurance. Insurance company is a financially based transaction. They don't accept or deny a claim because they're nice people, they're like a good neighbor, or on your side. They do so because they know that the person opposing them is likely to be able to prove whatever it is they need to prove. And the dynamics right now favor denying these claims, because why, as an insurance adjuster, would you accept a claim and have to answer to a supervisor who says, how are they going to prove that was causally related to the employment? And you say, well, I don't know. I just felt bad because they worked in a nursing home. Well, that doesn't get you a promotion or a raise when you work for an insurance company. It may move you towards sainthood, in the next life. But you have to understand that this speaks to that financial dynamic that says, let's make those claims acceptable and put the burden and the expense of defeating the presumption on the people that have all the information needed to prove, look, we were clean, we took precautions, we gave PPE, people weren't washing off old protective equipment like you heard from the woman who spoke on this bill. Those were the sorts of things we were all reading about in the newspaper. And that's why these people got sick. So they were there for the people. They risked their life for people. We need to say to them now, if you got sick, you're covered. So we urge favorable report on this bill.
Thank you. We also have the favorable with amendment testimony coming from Lance Kilpatrick.
Thank you, Carichelli, and members of the Finance Committee. For the record, my name is Lance Kilpatrick, and I am the Legislative and Political Director of AFSCME Council 3, representing 30,000 state and higher education employees in Maryland. We have never dealt with a challenge like COVID-19 before. Frontline employees across Maryland have fearlessly continued working even though shortages of PPE and information have caused serious obstacles for that work. They heard the call and responded to the challenge put before them. Like I said, though, endless obstacles were put before us. A lack of PPE from the very beginning, a fight that is still ongoing over getting N95 masks to our members and appropriate gowns for those in closest contact to the virus, a lack of planning and safety protocols that have led to wildly divergent responses to outbreaks from facility to facility and campus to campus. Our neighbor to the south, Virginia, became the first state in the nation to establish detailed coronavirus-related safety mandates that all companies under the jurisdiction of VASH must abide by. MOSH has not. And I would be remiss if I didn't point out that Maryland's chronic understaffing of its facilities made a bad situation worse. To be clear, correctional officers don't have a choice to socially distance. Staff at state psychiatric hospitals can't not engage their patients. And RAs and transit drivers at DJS can't not engage the youth at their facilities. All of this has come with a horrible cost. Thousands of state employees have contracted the virus while continuing to serve Marylanders. We applaud Senator Klossmeyer and the other General Assembly members who have championed workers' compensation eligibility for those stricken by the pandemic. As has been stated by Ms. Bragg and others, the long-term effects of COVID-19 are still being discovered. And while we are still learning of these effects, we know that a fair and equitable starting point for presumption of workers' compensation eligibility should be the date of the declared emergency, March 5th, 2020. We respectfully request that the bill be amended to retroactively apply to that date. We thank you and strongly urge a favorable report of SB 813 with amendment.
Thank you. We're going now to Carmine D'Alessandro, unfavorable.
Senator Kelly, I believe, Jim Lanier, I believe I was up on this bill as well. I just have a brief comment.
Wait a minute, no, you weren't signed on this one.
Oh, my mistake.
Okay, I'm sorry. Okay, Mr. Carmine D'Alessandro.
Thank you, Chair Kelly, members of the committee. For the sake of time, obviously, I will adopt all the opposition testimony in the prior bills. And unless there are any questions, I will let you call on the next individual. Thank you.
Thank you. All right, Robert Erlinson.
Am I unmuted?
Yes, because I'm hearing you.
Okay, you can hear me. Okay. First of all, in response to the arguments that those evil insurance companies are out to take advantage of people that are designed to be part of this statute, there is one very quick answer to that, and that is there are a group of people who are there to protect the worker, and it's called the Workers' Compensation Commission. I'm very certain that none of them begin their day by pulling wings off of flies. They are there to hear cases fairly and honestly, and they render decisions accordingly. So that, therefore, if there are any insurance companies who are taking advantage of people, there's a very quick remedy for that. Secondly, I believe that they're in the 812, and I think that there are amendments to make this statute retroactive again in this bill. Jim Lanier, just shake your head up and down. Right? Okay. All right. I just have a very quick response in addition to the arguments that I've raised previously. Those arguments are as follows. In the last year, Easter, Passover, Memorial Day, 4th of July, high school and college graduations, summer vacations, Labor Day, Jewish holidays, Thanksgiving, Christmas, New Year's Eve, and the top of all, super spread of all, the Super Bowl. All of those are events which have been described, at least in our national media, as super spreaders. And yet, if this bill is enacted with the presumption that's contained in there, the employer is effectively responsible not only for what happens in the workplace, but all of the events that I have described to you all. And I think that that is a terribly unfair burden, particularly when you look at the chart of people and the spread of the disease. Right around those events, it goes up, and when a couple of weeks later, it goes down. The last point I'll make is that in addition to everything else, the rebuttable by employers of the presumption is that the employer, according to page 6, lines 4 and 5, the employer and insurer have to show that employment was not a, quote, contributing cause to this. I don't know what that means. It's not defined in the statute. And I fear that once this statute is passed as is, that we're going to be involved in years of litigation over what is a contributing cause. Is the person just sort of standing on a street corner next to their workplace? Are they in the workplace? Are they thinking about their job when they're taking a morning shower? These are the type of things that have to be thought through, and I don't think it should be, that is not defined properly in the statute. So we therefore ask for an unfavorable report.
Thank you. And our final witness on this bill is Angelica Bailey. You have 2.5 minutes.
Good evening, Madam Chair. Thank you very much. Angelica Bailey. I'm the Director of Government Relations for the Maryland Municipal League. We are testifying in respectful opposition of Senate Bill 813. MML understands that that these are challenging and scary times, especially for our frontline workers. But this bill and other bills similarly situated create an unworkable expansion of workers' comp. The proposed presumption is just too strong. An employer can only rebut the presumption if they can show that employment was not a contributing cause. As Mr. Erlandson mentioned, that's not defined. We're very concerned about that. It can be more straightforward for something like spraining your back. If your job requires you to lift heavy objects, that's a specific and traceable incident that's clearly related to the job duties themselves. But how can an employer make that case when we're dealing with an invisible and highly contagious disease? How is an employer supposed to know whether an employee takes precautions outside of the workplace? Even if they do, no one is perfect. And Madam Chair, you made a good point earlier this afternoon, people engage in risky behaviors. As Ms. Jabin with MACO said earlier, just because something is discoverable does not mean it will be discovered. So in practice, rebutting this presumption, we're very concerned with, and the resulting increased cost to local governments could take away resources that could otherwise go to constituent services. And our folks are already on top of this. Several people have testified today that the current process is working, and that's been our experience as well. Several municipalities have anecdotally reported employees filing workers' comp for COVID infections under existing procedures with no issue. Our members are already taking good care of their people. We appreciate the good intentions here, but we think that this is unnecessary and unworkable, so we respectfully ask the committee vote no on Senate Bill 813. Thank you.
Thank you very much. And that is the end of the testimony on that bill. We're going next to Senate Bill 810, Senator Feldman. And you know the drill. And Adam Santry is your lead proponent. That person will get 5 minutes. All others will have 2.5. And you have, of course, the time that you need to explain the parameters of your bill.
Thank you, Madam Chair. And I know as much as we want to continue on presumptions, we're going to shift gears here to something completely different. Madam Chair, members of the committee, so by this time, I think most of the folks in the committee and even Senator Reedy, I don't see him there, are generally familiar with our renewable portfolio standard, RPS program that we have in our state. And we continue to debate, even this session, various modifications to that program. And we, Madam Chair, you had the black liquor bill this year. We have this back and forth on the floor and in the committee on waste energy. And I know Senator Hershey has the bill. So this is continues to be an evolving subject about the RPS. And as I said before, the Biden administration's made it very clear they're going to be investing big bucks in the clean energy space. And it's the states that are going to get their infrastructure in place are going to be the states that really benefit from all the, I think, federal investments that are likely to happen over the next few years. And so the RPS program from the beginning has focused a lot of attention on solar and wind. And, and for good reason. And we ramped up in this committee a couple of years ago with the Clean Energy Jobs Act, some of those goals. By 2030 and with an enhanced carve out for solar. So we're still working on that. But there's another type of clean energy technology, Madam Chair, members of the committee, that is really starting to take off right now. And it's basically, I think, where solar was maybe 15 years ago. And if I was to say it's a technology that has no emissions, so it helps us meet our greenhouse gas emission goals, which we're debating this session. It's a technology that does not involve any combustion. It's a technology that helps us with our grid resiliency by shaving peak use demand off of the grid, which was a problem in Texas recently. And it holds a lot of upside potential economically in terms of in-state job creation possibilities. And that technology, and that's why you'll see a lot of support in the testimony from organized labor. because there's good high-paying jobs involved. And the technology, Madam Chair, I'm referring to is geothermal. And geothermal clean energy, when I refer to that, we're talking about cooling systems, heating systems that tap into the constant temperature of the earth, basically, which is essentially constantly around 54, 55 degrees. You go 6 feet down. It uses only a very small amount of electricity. Again, uses no combustion. We're not talking emissions. And it's about 500% more efficient than a standard heating system, for example, or cooling system or HVAC system. Again, it lightens the load on the electric grid during peak summer demand, which is important. When I say 500% more efficient, translates into maybe 65% cheaper energy in your home. So it's really a good thing. The other thing, in terms of recouping your investment, and you'll hear some testimony, somewhere between 3 and 7 years, you can recoup your money because of the savings. In terms of the job potential, we're talking a very capital intensive set of projects. So, when we talk about this very capital intensive, you're talking local contractors, HVAC contractors, drillers, geothermal drillers make between $75,000 and $120,000 a year. And so we want to get out front in this space of geothermal, and that's what Senate Bill 810 is designed to do. So what does 810 specifically do? So geothermal is already in our tier 1 status in the RPS, but we're trying to give it a shot in the arm here with this bill by creating a very modest carve out, similar to kind of what we do for solar, but at a much smaller scale level, much smaller, for post 2021 geothermal systems in tier 1 beginning in 2022. So this carve out would just be 0.15, very small, ramping up to 1% starting in 2026. And by doing that, again, by having a carve out, I think, again, we're giving it a jump start, emphasizing in-state jobs, which I think has been a source of discussion. And so that's basically what the bill does. A second part of the bill, also in another bill, the earlier section, I talked about everybody should benefit, not just people with money. The idea of having benefits for low and moderate income folks. So a second part of the bill has to do with spreading the benefits around, equity, if you will. So in addition to this carve out that I referenced, there's a sub carve out in the bill. So under the bill, 25% of the RECs, so to speak, must benefit low and moderate income Marylanders. So there's a sub carve out within the big carve out, which I think is very important. There are alternative compliance payment provisions in the bill. Those monies go to the C fund and then in a special fund, which then can be used directed back to make loans and grants to support creation of new geothermal heating and cooling systems owned by low and moderate income Marylanders. So that's part 2 of the bill. And then finally, on the job creation front of things, again, very capital intensive nature of these geothermal projects. And we've talked about in this committee and other bills about the need and the importance of putting in place programs to train workers for the future, for clean energy jobs into the future. And we're trying to do that here. We had a debate about coal-fired power plants and displaced workers. We got to train the workforce for the future, transitioning from fossil fuels to clean energy. And so what we have here in the bill is for large-scale geothermal projects, and that is being defined in the bill as 360,000 BTUs. We're talking about big projects. For those large projects, we're requiring that 10% of the employees that are in that category of larger projects be registered essentially in apprentice programs. That we are trying to, again, creating a pipeline here. And there's some other labor standards in the bill as well, but that is just for the larger scale projects. Again, we're trying to get apprenticeship programs here, training folks, some labor standards. And also finally in the bill, this is, I think, the beginning. As I said, I think this is where solar was 15 years ago. So we really do want to the bill is the starting point, but we're also having Maryland Energy Administration. We're asking them to put together a work group, do some technical studies on geothermal, and come back to the General Assembly with some recommendations on how to incentivize increased deployment of geothermal heating and cooling systems in Maryland. So there's really, again, that's basically what the bill is. Now, I have talked to the Public Service Commission and Chair Stanek, and he, in his testimony, Madam Chair, if you look at, he's raised several issues in the letter, and he raised it on the House side as well. So, and primarily, if I might just, I have some amendments that I think address some of his concerns. He talks about some technical concerns. So first of all, there are a couple amendments are technical in nature. I think address some of his technical issues that he raised. Number two, PSC talks about not being in a position to certify some of the labor requirements in the bill. One of the amendments I'm proffering will strike that provision from the bill. Third, the PSC didn't like the idea of some of the reporting requirements of the bill. And a third amendment, Madam Chair, would strike those reporting requirements imposed on the PSC from the bill. And then a final amendment basically inserts some standard uncodified language that's been used in our other RPS bills, that this bill has no impact on presently existing obligations. This is really prospective. And so now the two areas I'm still talking to the chair with, we talked as recently as last Friday with him and his staff. Two other issues he raises in the bill dealing with the low and moderate income part of the bill. He raises concerns about how to identify who those folks are, which is, I think, legit. And then finally, he questions whether the carve-out provisions, percentages that are in the bill are achievable. The one thing I would make a note about that is that he's basing it, or the PSC, I should say, is basing their current registration numbers from a baseline on, in terms of how many geothermal systems are currently installed, basing on how many registered projects have been registered with the state. The problem with that is currently in Maryland, because there's no carve out or anything, the recs for geothermal are basically worth nothing. So nobody's registering because they're of no value. There's no incentive to register because there's no money involved. So that baseline number that it's in the letter, I think is not an accurate number. I think you're gonna hear testimony, but that's another issue. Those two issues, I think we're still talking about. And with those amendments, Madam Chair, I'd ask for favorable, but I'll continue to work with Chair Stanek on those remaining issues, that he's raised. The only other, I'd be remiss if I didn't mention, there is one other letter of opposition in testimony from ABC. Just two quick points, and then I'll open up for questions, Madam Chair. So I'm not sure I fully understand the opposition from ABC. Now they say the intent of the bill is good. They like the idea of going to geothermal. But they say the intent of the bill is to serve low-income areas. That's not the intent of the bill. That's one part about the 25% sub carve-out. The main intent of the bill is to try to get us jump-started in geothermal broadly. So I think they're misunderstanding what the bill does. And they talk about, we definitely need some good credits and incentives for geothermal. I interpret their paragraph as saying they don't like this kind of incentive using RECs, but I'm not, maybe they'll testify, maybe flush out a little bit. We don't have a lot of money for new tax credit programs and rebate programs. I think that's what they would prefer. This REC process is how we're incentivizing solar and wind. So this seems like an existing vehicle that I'm tapping. So that's all I'll say, Madam Chair. And with that, I'll certainly pass it on to next witness, or I'll try to answer any questions.
I'm glad that you addressed the chairman's, that is of the PSC's concerns, and that you've got some amendments to address the part of what that's suggested. What you have specified as the intent of your amendment sound very good, and I think we got to go with all of the modalities that are available to us to get where we need to be. Senator Hershey.
I'm shocked that Senator Hershey has a question about this.
Well, Senator, you did an outstanding job of presenting the bill, but I didn't follow at the end where you talked about the valuation of the RECs. And obviously to incentivize this, it's not that we put down on a piece of paper that our goal is 1%. The incentivizing comes through the price of the RECs. So do we have any idea on what these RECs would trade for, or how do we know that, or how can we go forward with this bill not knowing necessarily if this is enough to incentivize additional projects?
I knew you would ask that question, and that's why, Madam Chair, the next witness, my 5-minute designated witness, who is the head of the Maryland Geothermal Association, I think is prepared to address Hershey's very good question.
That's fair. I appreciate that. Thank you, Senator.
Thank you. That sounds like a good place to go next. So why don't we go to Adam Santry, who has the 5-minute slot.
Thank you. Good afternoon, and thank you for the opportunity to provide comments. I'm Adam Santry, president of the Maryland Geothermal Association, which represents over 30 residential and commercial well drillers and 100 HVAC installers and manufacturers. I'm also speaking to you today as president of the geothermal drilling company, Allied Well Drilling, headquartered right here in Anne Arundel County, Maryland. Allied is one of the top geothermal drillers in the country and employs more than 100 people locally. We've worked closely over the summer and fall with the bill sponsors and all of the proponents who have submitted written testimony today to craft a bill that seeks not only to grow geothermal in Maryland, but to do so in a way that truly makes it accessible to all Marylanders. In addition, this bill will grow high quality, high paying jobs and help our state to achieve its RPS goals in the most efficient and cost effective manner possible. I think you all agree from the list of bill proponents who have weighed in here today, as well as those on the House bill a week ago, that this bill achieves those goals. We have the support not only of the small businesses that make up Maryland's geothermal industry, but of LIUNA, the building trades, the AFL-CIO, low-income advocates, the NAACP, environmental groups, and ratepayer advocates, all together in support of this bill. Among its many benefits, Senate Bill 810 will help us make Maryland a leader in geothermal development again by creating a REC carve-out in the Maryland RPS for geothermal heating and cooling projects developed in our state. Typically, the majority of our utility bills are generated through heating and cooling. Geothermal technology makes the biggest positive impact on Maryland's residents' utility bills and our state's energy goals. By including geothermal in the RPS, we will guarantee that all of our geothermal RECs are generated in state. I think that's a critical point. This is especially important because more than 80% of RECs are generated out of state today. All of our projects will be built in the state of Maryland and directly benefit our state. This bill will ensure an equitable deployment of geothermal heat pumps by requiring that 25% of all projects benefit low and moderate income homeowners and communities across the state. The bill will provide high quality, high paying jobs in the state with family sustaining wages and benefits. Commercial projects will ensure that at least 10% of the employees working are enrolled in an apprenticeship program approved by and registered with the state or federal government. As the Vice Chair did a great job pointing out earlier today, you will hear some concerns raised by the Public Service Commission. We are working with the bill sponsors and Chairman Stanek and the PSC staff currently to address those concerns. Two are being addressed directly through sponsor amendments to remove the requirements that they certify large-scale geothermal installations and produce an annual report. We support both of these requirements being removed so as not to create an additional burden on PCS staff. In conclusion, geothermal is reaching a tipping point. Senate Bill 810 will provide the incentives we need to dramatically grow the geothermal market here in the state of Maryland and allow us to invest in the cleanest and most efficient electrification technologies to benefit our economy, our environment, and all Marylanders, not just top income earners. The Maryland Geothermal Association asks that you pass this important piece of legislation.
Thank you. Senator Hershey, did you have your hand up?
Yes, Madam Chair. I was wondering if I could just follow up my question to Senator Feldman with Adam to discuss the valuation of the RECs and how they would provide the incentive that they believe is necessary in order to boost this technology.
Absolutely.
ahead.
I think you're also going to hear another presentation from Dandelion Energy. What we've seen in other states is because geothermal is so efficient with the carve out that we're looking for at a 0.15 is very modest. The typical rec in the first year, you're looking at trading somewhere between $60 and $75. That's historically much lower than you've seen other programs need. And the reason being that is geothermal, because it's so much more efficient, we need less to get more, which is, part of the beauty of it. So if you look at that example, you'd be looking at somewhere between $1,500 and $2,000, in first year coming back towards the homeowner, which would go a big way to offsetting just the drilling costs. So when you're looking at a geothermal system, you have two parts. So if you were getting it at your own home, Senator Hershey, you would have to replace your heating and air conditioner, which you would have to do anyway, and then you'd have the drilling cost. So what the RPS will do is it'll actually eliminate a lot of that first cost hurdle, which all it is just the additional loop in the outside field. So you're going a long way to probably eliminating almost 2/3 of that cost, which would be really big. And the same thing similar for schools. If you're going to build a brand new school, Easton Elementary School that we just did geothermally, the actual interior equipment cost is very similar. Where all the savings comes from is actually installing those loops actually outdoor in the ground. And this would be a major contribution towards that to help them get over that first cost hurdle.
Okay, that's sufficient. Thank you very much. Thank you, Adam.
Thank you. Okay, we're going next to Rick Benetti.
Thank you, Madam Chair and members of the committee. For the record, Rick Benetti here. I represent LIUNA, the Laborers International Union of North America, and roughly 4,000 members living in Maryland who are in support of Senate Bill 810. I think the bill sponsor and Mr. Santry hit it all, and you have my written testimony, so I won't repeat what they've already said. I do want to thank the committee, however. As you recall, you held a briefing last October, I believe it was, where we got together and we talked about how to sort of bridge the gap between labor's needs and the need for the state to continue meeting its RPS goals. And we had a lot of discussion there. And this bill, I think, is a prime example of what at least the trades were speaking about at that briefing. In that, if you build requirements into the RPS to create the pool of workers for the new technology coming down the road, that's all you need to do. This bill has a 10% apprenticeship requirement on it. The state doesn't need to set up an apprenticeship fund. The state doesn't need to create an extra tax credit for apprenticeship programs. All it simply needs to do is to create, make smart legislation that allows labor organizations like the one I represent and companies like Mr. Santry's as the market for geothermal grows and the need for workers grows, my organization and contractors, Maryland contractors, are going to be able to figure out what kind of training and apprenticeship standards there need to be in terms of a program to ready a pipeline of workers for this work as this market grows. So that's exactly the point we made at that briefing back in the fall. And again, I just want to thank the committee for its work and just reiterate the point that this is the kind of legislation that can really help both the state in terms of meeting its RPS goals and organized and labor and make sure that there's middle-class jobs that go along with it as we meet those goals. So I urge a favorable report. Thank you.
Thank you. I wanted to ask either you or the sponsor, what kind of costs would the typical Maryland homeowner have to go from the current regulated utilities that we use to geothermal?
So it depends on how you look at it. If let's say you're tomorrow, hopefully not, because I think it's going to be 70 degrees tomorrow. But let's say when the heat finally heats up, your air conditioner does go out. Okay, it does fail, and so you're already going to replace it, because that's kind of the time that people really look to do it. Is you're already needing to make a decision because you're going to have to spend the money. So you go out and you make an evaluation and you say, I would like to get geothermal in my house instead of going with a traditional system. The interior units, their cost is going to be about the same. It's in the exterior geothermal loop. So the average house in the state is going to be anywhere between, on just the exterior loop, because once again, you already had to buy that interior equipment, you're probably looking anywhere between $6,000 and $10,000 additional. And that's that first cost hurdle that people just can't get over that, right? They really want to do it because the payback, like you've heard, is between 3 and 5 years, but they didn't plan for that rainy day when their heating and air conditioning equipment was going to go out. So they don't have that extra funds to get them over that so they can reap the benefits on the savings. And that's what we see.
Because each homeowner, once they have the system in place, are kind of self-sufficient. They're not on some global system of some kind, and there's nothing to send as a bill to a utility company, and therefore the PSC, I guess, wouldn't be regulating it. Is that something?
No, man. Once it was installed at your property, it's done. It actually comes with a 50-year guarantee in the ground, and you were generating energy off that system into your home for 50 years. So once it's installed, it would be installed at your house. It would be 1 or 2 holes in the ground, and that would service your home.
Okay, thank you. Okay, let's go into Stacy Hartwell.
Good afternoon, Madam Chair, committee members, and colleagues. On behalf of the NAACP Maryland State Conference, I'm here to give testimony to strongly urge a favorable report on Senate Bill 810, Renewable Energy Portfolio Standard and Geothermal Heating and Cooling Systems. Again, for the record, my name is Stacy Hartwell. Limited income households, communities of color, and other disadvantaged communities stand to benefit the most from renewable energy deployment through energy bill reduction and improved public health outcomes, but often have the least access to the benefits of renewable energy programs. Senate Bill 810 would create incentives for more renewable deployment by including geothermal in our renewable portfolio standard, as you've heard this afternoon. Yet more importantly, it would ensure low and moderate income households are the beneficiaries of this addition by calling for 25% of the systems to be installed in homes and community centers that house and serve low and moderate income ratepayers. Low and moderate income Marylanders would be able to see the benefits and be able to recoup the savings on their energy bills within 2 to 10 years through savings on their utilities. Maryland's low-income residents pay 550% more as a portion of their income for energy than non-low-income Marylanders. The majority of these households are Black, Hispanic, or Asian. COVID-19 has exacerbated this inquiry with over 209,000 residents in arrears in PEPCO and BGE territories. By deploying geothermal energy in homes, we could improve indoor air quality that could result in improved health outcomes for low and moderate income households. Senate Bill 810 would also create, as you've heard, a growing geothermal industry, that provides family-sustaining jobs and a sustainable planet. The bill calls for installers to provide health care, apprenticeship opportunities, as well as family-sustaining wages. For all of the reasons above, the Maryland State Conference of the NAACP urges a favorable report on Senate Bill 810. Thank you, Senator Feldman, for your leadership on this important legislation, and thank you all for your time and consideration.
Thank you. Okay, we're going next to Kathy Hannon.
Hi, thank you so much for having me speak today. My name is Kathy Hanoun. I'm the co-founder and president of Dandelion Energy, the nation's leading provider of home geothermal heating and cooling systems. I started Dandelion at Google X and then spun it out as a standalone company in 2017. I started Dandelion because geothermal heating and cooling is not only the single most efficient way to heat and cool buildings, as we've been hearing from many speakers, it's also the least expensive on an ongoing basis. That being said, as we've been talking about, geothermal adoption has been limited to date because of its higher upfront cost. Dandelion really exists to change this. We're bringing new technology and new business models to the problem so that all homeowners can adopt and benefit from geothermal technology and not just the wealthy. If the incentives that are being discussed today are implemented, Dandelion will expand into Maryland. We will invest in opening a warehouse here and hiring up and training a Maryland-based team. We're also in the midst of discussions with our investor, Lennar, one of the nation's largest home builders, about doing a pilot in Maryland to assess the feasibility of putting geothermal systems into new housing developments. The incentives being discussed today would strengthen the case for doing this tremendously. One thing we've done to make geothermal affordable is introduce loan products that allow customers to get geothermal installed with no upfront payment, and then use their energy savings to pay back the cost of their system over time. This is the payment model that more than half of our customers select today. The incentives being discussed here make this type of payment model possible in Maryland. Because the majority of energy used in homes goes towards producing heating, cooling, and hot water, converting homes to geothermal is the single best way to decrease residential carbon emissions. These incentives would dramatically boost geothermal adoption in Maryland and pave the way for companies like Dandelion to bring geothermal from a luxury product into the mainstream. Thank you.
Thank you. All right, let's go next to Amanda Best.
Good afternoon, Chair Kelly, Vice Chair Feldman, and committee members. I am Amanda Best, Senior Commission Advisor at the Maryland Public Service Commission. I want to make clear that the Commission does not oppose the concept of a Tier 1 carve-out for geothermal systems under the RPS. I'm testifying today on several technical concerns we have identified with our role in overseeing compliance with and implementation of Senate Bill 810 as filed. As Vice Chair Feldman mentioned, we have received a copy of the draft amendments, and we're reviewing them to ensure our concerns are addressed, and we're happy to continue in that dialogue. But to quickly summarize our issues on the bill as filed, 2 issues are related to ensuring compliance with the law. The Commission may have difficulty determining if a system meets the low income and employee requirements for certain systems required by Senate Bill 810, particularly the issues related to employment, salary, and benefits, as we do not currently have the expertise in these matters. 3 issues are related to current resources available at the Commission. The Commission would need to hire consultants and additional staff to develop the regulations, conduct the 2 reports due in 2020 and 2021, and conduct the engineering analyses for non-residential systems, as the Commission does not currently have the resources to do so. Our final concern is related to meeting the goals of the geothermal carve-out created by Senate Bill 810. Based on historical data that we have from the RPS, geothermal RECs represent a small number of the Tier 1 RECs retired in compliance with the RPS, and to meet the 1% carve-out by 2026, an increase of about 278% would be required from 2020 levels. With that, the PSC respectfully requests an unfavorable report on Senate Bill 810. I thank you for your time, and I'm happy to answer any questions.
So if I'm understanding, you don't oppose the concept and this technology. You're just concerned that right now, if you're responsible for analyzing and evaluating and reporting and so on back to the General Assembly or to anybody else, that it would cost you something that would break your budget. Is that it?
That's correct. We have some staffing concerns, and really it's just focused on the implementation, not specific to the carve out or the technology.
All right, let me ask this.
Madam Chair.
Can I ask this one question? I'm coming back to you.
Yeah.
If we could find a funding source that we could put into place during this General Assembly session to help you with the evaluation and reporting and so on, what as a maximum might that be?
I'd have to go back to a team and check on that, and I can certainly get back to you on that. I'm not the expert necessarily in the HR, but I'm certainly happy to get back to you on that.
Because it sounds like if you're unopposed to this great source of energy that would be self-sustaining for many years without a lot of cost to homeowners and so on, maybe to nonprofits, to medical entities and so on. And we just need the funds so you can have the wherewithal, the resources that you need to assist us in getting there. It seems like we ought to work on that, wouldn't you say?
Yeah, I I think we're happy to look into that. And like I said, I can take that back to my team and we can get a response to you.
You can get right back to us. We'd appreciate that, Mr. Sponsor.
Yeah, just a couple things. Just, Madam Chair, as I mentioned, I just want to be clear, the reporting requirements you talk about, one of the amendments is to delete some of what Ms. Best just talked about. So there are no, it strikes those reporting requirements, and then the certification as well about labor that Ms. Best referenced again are taken out. Although I would make this one point with respect to labor or compliance. I think our Department of Labor, truthfully, that already they could probably be helpful on that front in terms of monitoring some of the labor stuff, even though one of the amendments strikes that requirement. I think some collaboration with some of our other agencies, could sort of fill that void. So I just wanted to throw those points out, but some of the points that were made are actually dealt with in the amendments. So.
Okay. Senator Hershey.
Thank you, Madam Chair. Amanda, you also in your letter expressed some concern that there could be risk that not a sufficient amount of systems could be deployed as quickly as the goals would require, and thus suppliers would have to pay the alternative compliance payment. Could you elaborate on that a little bit as well, too?
Certainly. So, the PSC has kind of limited data points on geothermals. We really only touch them in two ways: through the RPS, when they are a registered facility to generate and retire RECs. And then there's also some incentives available through the Empower program. And so just based on our historic data, we've only really seen that we currently have 94 registered geothermal renewable energy facilities. But in the most recent numbers that we have, they only retired less than 0.1% of the RECs generated. And so even though we have a decent amount of facilities registered, they contributed a small amount of the RECs that were retired. And then really on the energy efficiency side, we've seen about 4,900 systems rebated through Empower since 2012. And so our concern was just that based on our own historical data, we were just concerned that maybe there might not be as many facilities available to meet this 1% carve out. But we have been in talks. We think, there is, I believe, another bill where MEA would conduct a study as well. And so that might provide some really insightful information on what the landscape of geothermal is in the state.
Okay, and that's important because currently geothermal is a tier 1. So obviously it benefits off the tier 1 REC prices. But I think what we're seeing, and if Madam Chair will let me ask Adam as well, what we're seeing is that the subsidies through the tier 1 RECs are not enough, or what you're saying is not enough. So that's kind of leading me back to the question of what does a geothermal REC look like as far as the price? I mean, we can compare tier 1 RECs. We know what the SRECs look like. What is a geothermal REC going to have to look like in terms of subsidies and in being able to make this efficient for you to do your types of projects?
Sure. Let me lead off by saying, the information that they have, the PSC currently have, it's incorrect just because no one's registering, because like Senator Feldman said earlier, the current REC price it's worthless. It's basically worth nothing at all. So, last year alone, we have the actual shipping data to the state of Maryland. There was 14,000 tons of geothermal equipment shipped to the state. So the initial first year number in the carve out would account for about 80,000 RECs, and the target is around 90,000. So that's why when we say it was a very modest first year goal, I think we've learned from the past when it comes to the RPS that when we look at that, let's under promise and over deliver. So we actually already have that historical data. In addition to that, there is hundreds of schools, in everyone's county they have alone, there's hundreds of schools that have geothermal. and there is going to be hundreds more that have it. The PSC has never received a single application, not one. So when you look at the number of RECs that are going to be generated through schools, if you look at the Build to Learn Act and the number of schools we're going to build, one of the requirements in that is they have to do a 50-year analysis for geothermal. Well, when they do that 50-year analysis for geothermal is going to prove to be the most viable technology. One of the documents that we presented to the PSC was there was a school recently that came out and they had the analysis done. They had a 30-year life cycle analysis. In that 30-year life cycle analysis, one middle school was going to save $16 million if they went geothermal. They did not go geothermal because they couldn't come up with $700,000. So as a state, we're going to spend an extra $16 million over 30 years because we couldn't come up with 700. When you look at the way the RECs will price out, about half of that first cost would have been overcome with this REC program. That's critical. And if they're able to aggregate like solar is and sell out 5 years, Senator Hershey, they'll be able to sell out 5 years of RECs and overcome that first cost hurdle 100%. So, I respect the information that Amanda has, but it's just because no one's reporting it. I mean, I'm doing more installs than that in a year. You guys all have that many schools in your district that have geothermal. We've just been unable to capture that information because no one is registering for it right now.
Adam, it sounds like two different things because what you're saying there, it sounds like the state is providing you with the demand for geothermal with the school systems. And as Senator Feldman said, I mean, we have certainly, when we started with the RPS, it was to incentivize new technologies and give you that kind of kickstart to get going. So I'm a little confused if that kickstart is needed to get you going, or is this just something that's necessary to subsidize the cost of your product?
It's absolutely, I feel, necessary. I mean, we're talking about being the most efficient technology out there. And, the first year goal is to get us to 0.15, and we're not there yet. So if you have the most cost efficient technology that there is, and you have Marylanders who don't have access to it to first cost, and we're consistently incentivizing other technologies over this, I mean, to me, this is the point of the RPS. That's why I think this is such a wonderful bill. I mean, we're going to be able to take geothermal technology. It's actually going to reduce the cost to implement the whole RPS because the amount of energy production we're getting for what is a very, very small ACP in the first year, it's less than 25% of what the initial solar ACP was. So, I mean, it's extremely business friendly, it's environmentally friendly, it's labor friendly. I think this is exactly the purpose of it, in my opinion.
All right,
Let me
thank
ask
you.
you this, if this bill or the state budget could come up with about 40 times 700,000 to get some demonstration projects done that would have public impact, maybe schools, libraries, senior centers, or something like that, would that be reasonable to help us get established, to show the value of having RECs for this?
I mean, any government source of funding would be helpful. What I love about this methodology is everyone can benefit. It doesn't matter if you're in Western Maryland or the Eastern Shore, if you're a school board, low-income housing, or a private resident, they all should gain access to this. I mean, this will literally it'll touch private, it'll touch government, business. It takes care of our school issue. I mean, to me, this is a fantastic source to be able to address so many different issues all at one time. And, really what we're doing, and it's the goal of this, you're leveraging a very, very small amount of government dollars to make a huge impact and investment that you're going to get on a lot of these projects and the savings that you're going to reap. I mean, a single home is going to generate up to 23 RECs per year off of one house. That is just remarkable for the amount of funding that we're talking about compared to some of the other programs I know that, have been looked at over the years.
Madam Chair, if I could just finish, I just wanted Adam to know, I mean, Adam, I'm certainly supportive of the in-state job generation that geothermal will bring to Maryland. And the Vice Chairman knows that's certainly something that I've harped on when we look at the RPS. I wish we would be less supportive of wind projects out in Illinois and Indiana, though. And so maybe there is a way to find some type of a balance that we don't increase overall ratepayer subsidies, but we do really try to find a way to focus Maryland ratepayer dollars into businesses that are here in Maryland and doing projects in Maryland. And that's what I would like to see, and certainly be supportive of you that way as well. So thank you, Madam Chair.
Okay, thank you. Senator Augustine.
Thank you, Madam Chair. Thank you for your presentation. You answered a little bit of a question that I had with regard to how many RECs would be generated. You talked about 23 RECs, but I have to say to you though, sir, that you said it doesn't cost anything. It does cost the ratepayers. And I'm always worried about the ratepayers. And you really did kind of indicate that you are able to finance these projects and that it's actually working. I'm just saying, like, that's what you said when you talked about folks not putting their projects into the RPS, which is great. I mean, we want to encourage this, and it sounds more like you got maybe a financing issue, and it doesn't need for us to have to pay, have the ratepayers pay for this technology if the technology is working and is successful in its own right, which is fantastic. And I'm very supportive of that. But you said it's around 23, you say it's around 23 RECs that a home would be able to generate in a given year. And can you just help me to understand how that is measured, or how is it measured differently with the geothermal versus, let's say, like a solar?
Sure. On your first point on the ratepayer impact, I am very respectful of that, and we worked very hard. If you actually take a look at the bill and look at some of the projections on what that ratepayer impact is, I think you'll see, compared to some of the other things that came through, it is extremely small.
Yeah, I don't agree with some of the other things that came through too.
Understood. And one other important piece, I'd be happy to show you the study. There's also the other part is there is a peak demand shaving piece to this that will actually lower ratepayer impact across the whole entire state. It's something that we can share, an analysis that was done for Maryland and that's already been proven out in New York because of this. It's direct taking off peak demand. So how it's calculated is, geothermal makes energy. So the solar sun heats up the ground, it collects energy there. The way a geothermal system works is we're actually extracting energy, BTUs, out of the ground to bring into a home. So no different than when you have to burn, say, oil or propane in your house to make heat. We actually are sucking the BTUs right out of the earth where we have that free source of energy. And there's a conversion of BTUs to megawatt hours that comes into kilowatt hours, which is directly then translatable to the current RPS.
Okay. It stays in the home. Forgive me, Madam Chair. It stays in the home. This is not like one of those where
it stays in the home.
It doesn't go out of the home, right?
No, it stays in the home, because what's really end up happening is, when you're at your house and you get that monthly utility bill, it just says Baltimore Gas and Electric. It's not for your lights. It's not for your kids' TV or PlayStation. You go down to the basement, those two big double breakers, they're for your heating and air conditioning and your oil propane. That's what you're burning. That's what you're spending that whole bill on. If it was always like it is today, 60 degrees out, we had the windows open, we'd have very, very moderate bills. But we don't, because we have wild temperature swings. So in the summer in Maryland, it's 100 degrees. And in the winter recently, it's been 20. Well, our utility bills, all of us, are going to be through the roof for the month. Well, geothermal, because we have a constant temperature in the ground of approximately 58 degrees, we're almost simulating, like, during the summertime, we're getting our air from Maine, and during the wintertime, we're getting it from Florida, because that 58 degrees is just absolutely perfect. So we have that free energy source there, and we're using that free energy source. And, Kathy testified a little bit earlier, Kathy Hinnant from Dandelion, the only reason they're able to offer financing products in other states is because they already have these types of programs and rebates in place. They're able to take some of these rebates and grants and RECs, just like similar to an SREC, and they're able to use that as part of the financing model to offer that financing. Currently, without that program here, we don't have that mechanism.
Thank you. I appreciate that. Thank you.
Thank you, sir.
Okay, thank you. Okay, let's, I think that's the end of that testimony. We're going to Senator Hayes. Senate Bill 754, Public Service Commission, damage, obsolete, or excessive lines, fines. Senator, you have all the time you need. Your lead person is Johnny Martin Jr. with 5 minutes, and everyone else will have 2.5.
Excellent. Thank you so much, Madam Chair, and good afternoon, colleagues. I know we all have been here since 1:45 and we've heard 7 bills before this, but I'm joined today on a panel with some constituents, folks who aren't necessarily, paid to testify. They just have an issue in their community and they've taken the time and stuck around. We actually lost one gentleman due to the time constraints of today, but these are all volunteer, real life constituents that you will hear testifying before me. I'm pleased to be speaking with you today about Senate Bill 754, which will require the Public Service Commission to promptly notify the owner of your utility pole if the PSC receives notice related to a pole that's damaged or dangling lines, an obsolete or redundant line, or a public nuisance caused by excessive number of lines on a pole. I believe Tammy, our committee staff, has a PowerPoint presentation. Tammy, thank you so much. Here's some examples, fellow committee people. And then if you look in the bill file as well, there's other examples of what residents are experiencing as far as just redundant lines or, utilities just, stringing other lines together, although there's no use for old lines and stuff like that. And I'm not sure, and you could go to the next slide, Tammy. I'm not sure if this bill actually get to where we need to get to, but it's definitely a major concern in the community. And I'm trying to look for a solution and how we could fix it. I have gotten a lot of cooperation from the utility companies as well as the telecommunication and cable companies. Next slide, Tammy, who has expressed the interest in working on some of these things. One of the things, fellow committee members, there's a lot of, unfavorable testimony on this legislation. But I hope to work with all of the partners, as we have been for several months now, to try to address this issue. But at the end of the day, I definitely would like to establish some type of accountability where there's some type of report or something back to this committee in addressing it. The way this bill and this idea came to mind, you could go to the next slide, Tammy. I was actually involved in a community cleanup in a neighborhood called Penn North in the heart of Baltimore, West Baltimore. We were attempting to clear away some, alleys and lots, and the city crews that attempted to help us out could not trim the trees or whatever because there was wires of all different kinds actually going through the vegetation, and some of them was hanging down on the ground, very accessible to anyone that would pull on it. And so the city crews had to stop because if they would have continued, they may have run the risk of being endangered. I think this is the last slide, right, Tammy? Is there any other slides behind there? Okay, one more slide. And so we, I raised this issue, and part of the problem that our constituents face, we don't really know, as a layman, we don't know which line belongs to which, right? And I've had the experience. I tried to call BG&E says Verizon, you call Verizon says Comcast, you go, and I went through that experience. So it's problematic to the average constituent that had this going on in their backyard, not really knowing who to turn to. I would have hoped, because the PSC had worked with the utilities, and the utilities for the most part know where all the poles were, and drafting this bill, that they would be a point of contact that constituents could at least reach out to, instead of playing ring around the rosy and calling every utility in town to try to identify this problem. But even it looks like the PSC may have some administrative obstacles in doing this. In addition to my own experience in dealing with this issue myself, coincidentally, with no conversation prior to, Dan Roderick from the Baltimore Sun began to write several articles. And he got in contact with me because he said He's never seen the type of response that he's seen from, he just saw it as a nuisance, but he's never seen the type of response. And so some of the pictures we have here today, we asked Dan to reach out to some of the folks that wrote to him. These are some of the pictures that you see here today. Some of the pictures that are in the file are examples of that. Tammy, this is the last slide, right? You could close, I think. All right, cool. That was the last slide. But hundreds and hundreds of people have written and asking for some type of solution to deal with this. You know, one is a safety issue, public nuisance issue, among other things. And hopefully we could work with the, you know, the various entities that will be involved to deal with this. I won't hold us much longer. I'll tell you, like I said earlier, my panel consists of Johnny Martin, who will speak after me. Kelso had to leave due to the time today. Dan will finish up. So it's just myself and the two other gentlemen. But you have my testimony and everything in the bill. We just want to provide an opportunity where these entities that are working in our communities don't provide unsafe and unmanageable situations right in the backyards and the alleyways of many of our residents. And so with that, Madam Chair, I will end my testimony and look forward to working with this committee as well as some of the stakeholders to bring some resolution to these issues.
Thank you. And by Dan, you're talking about Daniel Richmond?
Yes, ma'am.
Okay.
Go after Johnny.
You're on next.
Johnny.
Thank you so much, Senator Hayes. And thank you, Madam Chair and Vice Chair Feldman and members of the committee for having us here today. So I just would quickly echo what Senator Hayes has brought to your attention, that and to also echo his story, not without us speaking, we had the same experience. I am the founder and CEO of Visionaries Development Cooperative, and we are a community development organization that is focused on several issues, primarily being home ownership, affordable housing, access to healthy food, retail revitalization, and tranquil community spaces. So one of our major initiatives that we work on is converting city-owned vacant lots that are normally plagued with dumping or high grass into useful community spaces. One of the major problems that we have run into in doing not only these vacant lot conversions, but also weekly community cleanups is exactly that, wires being excessive and vegetation being caught up into the wires. And one thing that I also mentioned to Senator Hayes, I honestly feel like this is also a public health issue, because these wires, once they're caught up and then all the vegetation grows up, then that turns into a net that catches trash and other things. Like, as we've done cleanups, we've pulled, you know, tons of diapers even, and just unsavory trash things out, you know, of these nets and out of wires and things like that. And like Senator Hayes and us contacting, you know, the utilities that we thought the wires belonged to, it just turned into a runaround of contact this person, contact that person. It's not our wire. We're not responsible, things like that. So wholeheartedly, myself and my community supports this bill, so that it just, you know, puts some accountability in place, you know, for the utilities and telecom and anybody else that is hanging wires to be, you know, aware that these wires need to come down when they're not in use and fresh wires are put up. And I also would mention that I would love to see potentially some community benefit language go into this bill, so that it gives it teeth. Because and I heard in previous testimony the Public Service Commission representative saying that a lot of things are built on capacity. So that would be a great way to involve the community at the community level. Organizations like ours, community associations, to be helping to kind of police this matter, if you will, bringing to the attention of the PSC that these things are are an issue, and also helping to potentially reach out to line owners to let them know that these things are an issue, giving them an opportunity to remedy it. And then if they do not, would love to see some language that if a utility is fined, that a percentage of that fine of some sort would go directly to the affected community, because this causes a huge problem, for communities to keep their communities clean, and also do improvements to the community, even at the lowest level. It's hard to do when you're, caught with issues like these unused and damaged wires that we don't have the capacity or the wherewithal really to get up on a pole and take down wires and things like that at the community level. So for that reason, wholeheartedly, we support this bill. We hope that, the committee will find the bill relevant and support it as well, so that matters like this aren't, public safety, public health issues for communities. So thank you so much. I won't belay the time, but that's generally what I wanted to say in support of the bill. So thank you for having me.
Thank you. And let me just be clear, is Daniel Richmond here?
Yes, ma'am.
Okay, let's go to Daniel Richmond. You have 2.5 minutes.
Okay, thank you, Chair Kelly, and thanks, Vice Chair Feldman and committee members. My name is Dan Richmond. I live in the Patterson Park neighborhood in East Baltimore. In 2019, there was a terrible fire on Rose Street, a couple blocks from me. And when people gathered outside to check on people who had evacuated their homes nearby and see what was going on, we could see directly that the fire started in a rear yard, spread up a utility pole behind the house, and it spread fast to that house and to neighboring houses. And one of the first things that many people out there said was that they wondered if the fire started or spread because of loose wires in the alley, and that this was something that they were always worrying about. And it was a worst fear, potentially a worst fear come true. So I told this story to highlight that this problem is pervasive and it causes a lot of anxiety. Alleys all over my neighborhood, most of the other neighborhoods I've ever visited in the city, can be like jungles with tangled vines of wires between utility poles or between poles and houses. Some even reach ground levels, many scrape fences and other backyard structures. So I'm concerned that they can make it easier for fires to spread. Telecom companies are neglecting to clean up after themselves, and they might even argue that they should not clean up after themselves, which would be mind-boggling. So the public lacks mechanisms to hold them accountable to keep our surroundings safe and pleasant. And I think empowering the Public Service Commission to require that companies investigate and clean up this leftover wiring and be able to fine them for non-compliance would be a great step. And so I respectfully urge a favorable report for SB 754.
Thank you. What about Chelsea Guccian?
Yes, Kelso had to leave, Madam Chair. So
Okay.
that's all we have
What
on our
about,
panel. And thank you guys.
Joy Chen?
Oh, Joy Chen.
Is Joy Chen here? Okay. You're next. You have 2.5 minutes.
Thank you, Madam Chairman, and good evening to you, Vice Chairman Feldman, and members of the committee. For the record, my name is Joey Chen. I'm Senior Advisor to Chairman Jason Stanek at the Maryland Public Service Commission. Let me begin by saying that the Public Service Commission does understand that there are legitimate public concerns over excess, unused, and dangling wires, and we certainly appreciate the intended goal of this bill. However, that being said, from our perspective, the bill as it's drafted does raise some significant concerns that would make its implementation difficult and ultimately might not achieve the intended goal of the bill, which is to facilitate corrective action. So first, there's a key jurisdictional issue as between the Public Service Commission and the FCC, the Federal Communications Commission. So while the PSC has jurisdiction over electric utility poles, the PSC does not have jurisdiction over pole attachments. So in Maryland, pole attachments and pole attachment agreements fall under the jurisdiction of the FCC. And under FCC regulations, Maryland electric utilities are required to provide non-discriminatory access to their poles. And where Senate Bill 754 would require that certain actions be taken by the owner of the line, The PSC might not have jurisdiction to enforce this, or the PSC's authority could in fact conflict with that of the FCC. But jurisdiction aside, as a practical matter, the PSC may not always know who owns the pole. And although poll numbers will help identify the right owner, this information is not always provided. And even when the proper pole owner is identified and notified, there's still a gap between notifying the utility pole owner and then compelling action by the owner of the wire. So while utilities enter into pole attachment agreements with these companies, like telecommunications companies, the utilities themselves do not regulate the attaching companies and in most cases cannot exert control over the wires. So to penalize the pole owner for the actions or inactions outside of the utility's control would not only be unfair, but it might not necessarily lead to correcting the offending situation. So for these reasons, the PSC respectfully requests that the committee give Senate Bill 754 an unfavorable report. But this being said, the commission would be happy to be involved in any ongoing discussions to find a workable solution. This concludes my remarks, Madam Chair, and I'm happy to take questions.
I was about to ask you that. I'm glad to hear that you're willing to be in discussions. If we set up some kind of a work group on this issue, could the PSC sort of be involved, assisting us to identify when something belongs to the PSC as opposed to the FCC, and these utility pole attachment arrangements, are they documented somewhere in public records?
So to your first question about the PSC's involvement with the working group, yes, I believe the PSC, we would be able to offer up our engineers and other technical team to take part in these discussions. Very similar parallel did happen with the double pole issues a few years ago. But as far as the the pole attachment agreements, I think that's your second question.
Yeah.
The commission itself does not, subject to check, I don't believe the commission itself has copies of these agreements. However, I will defer to the utilities to be able to answer or at least confirm that statement, because the agreements do belong, because they exist between the utility and the pole attacher. The utilities would have copies of those agreements, but as far as the commission goes, I'm not aware that the PSC retains copies of those.
So it sounds like Maryland needs to begin to develop a public census of all of these pole attachment agreements is one thing, doesn't it?
Well, certainly to understand what's out there, to get a sense of what's out there, who the parties are and what the agreements are, that does sound like a reasonable topic to be discussed by the commission, by the utility companies, by the telecommunications companies and the attachers to see what the best solution, best way of providing information to the public would be.
All right, and while all of this is not your primary problem, do you know of any counties or states elsewhere in the country that has worked out something to resolve this kind of an issue or to keep it from occurring in the first place?
Madam Chair, I'm personally not aware of that, but that's a question that I can take back to my team and see if they can provide other examples.
Okay, I'd appreciate it. Okay, are there any other questions? Okay, then we are going next to Damon Krieger, who's also unfavorable. And he's representing BGE.
Good afternoon, Madam Chair, Vice Chair Feldman, and members of the Senate Finance Committee. For the record, my name is Damon Krieger, and I am the Director of Support Services for Baltimore Gas and Electric Company. Among other responsibilities, I oversee the business unit that manages third-party attachments to our utility poles. Consistent with our written testimony, and at least as currently drafted, BGE respectfully requests an unfavorable report on Senate Bill 754. That being said, let me state right off the bat that BG readily acknowledges and shares the concerns voiced by the public regarding unsightly telecommunication lines attached to utility poles. And we sincerely appreciate the heartfelt testimony of Mr. Martin and Mr. Richmond today. In that regard, BGE is committed to working with the telecommunication companies to help address these public concerns for utility poles owned by BGE or jointly owned with another company. And in fact, joint ownership accounts for about 80% of our 360,000 distribution poles. Notably, and in recognition of public concerns, BGE started an initiative last year in 2020 to identify excessive pole attachments in our service territory, with an initial focus on Baltimore City. The next step is to engage the telecommunication companies directly to develop a plan and timeline for resolving excessive wire conditions. From BGE's perspective, the key is to ensure timely transmission of information to attachers on its poles of public or safety concerns related to their specific attachments. And to that end, BG is already in the process of expanding its internal tracking and reporting systems to provide notifications and in a more formal, systematic way to companies about excessive attachment concerns. At the end of the day, such communication enhancements and a properly constructed partnership with the telecommunication companies will better accomplish the goals of improving aesthetics, safety, and reliability than the path currently outlined in Senate Bill 754. Thank you very much, and I'm happy to address any questions that you may have about BG's position.
Well, I don't know. I'm going to get to you, Senator Augustine, what we're going to do about this bill. We're going to do something. And you can expect to hear from the General Assembly in some way, as will all other of the major utility companies that have these attachments. It's clear to me that all a kid would need is their kite to be caught up in something on the pole and go up there and maybe be electrocuted, even if there were a live wire or anything. But they certainly are aesthetically disgusting, and nobody should have to live like that. And I'm sure in the more middle class or upper class the neighborhood is considered to be, the less likely it's to happen at all. And it's just wrong, it's immoral. I won't say more, and you aren't alone, and you didn't cause it, but we've got to do something about it. Okay, who did I just tell you? Oh, Senator Augustine.
Thank you, Chair Kelly. You stole some of my thunder, but this is a big problem in my district. I mean, you know, it's an ongoing one. And so I understand what you're saying, Mr. Krieger, but this has been going on for years and years and years. And I will say this, when I talk to the folks on a pole by pole basis, which is what I have to do when I'm out in my neighborhood, I'm able to get them to do that, but that's just, you know, it doesn't make any sense that we have to go pole by pole to create an environment that works better for our neighbors, that is appropriate. I mean, it's ridiculous, the number of wires that we have hanging up and falling on the ground, everything else, at least in the area where I live and what I represent. But a question that I do have for you though, sir, because you told me something here that I'm very, very interested in. If you have these pole attachment agreements, in which you have, there must be within those pole attachment agreements that they can't go above a certain level, which is where your guys, the electricity portion of the pole is. Do you have those kinds of, or is that a part of those agreements? And is there also something in those agreements which says that these folks can't just keep stringing stuff up and leaving it for us to look at?
So thank you, Senator Augustine, for your question. So yes, we have attachment agreements with as you can imagine, the major telecom companies, so think Comcast, Verizon, and any other attacher to our pole structures. And those attachment agreements do specifically focus on safety, on reliability, such that attachments can't go to a certain level of the pole, as you indicated, such that it would interfere with our electric conductor, which is at the top of the pole when you think of a pole structure.
Yep.
The challenge here, as Mr. Chen indicated, is jurisdictionally. Federal law governs attachments. And so our ability is limited under our agreements to the safety and reliability served. So obviously we're very concerned if a lineman has to climb a pole, access a pole, and there's a crowd of wires there that prevents access. That could present a real safety issue for our employees as well as members of the public. And so in those cases, we have the ability under our agreements to take direct action. The challenge is if the coax cables, the fiber cables are in that middle space where federal law governs their right to be there, we really don't have the direct ability to take them off. And that's the challenge here. And so what we're hoping to do, and what we already started well before the introduction of this bill last year, was to identify those locations in Baltimore in particular, and then throughout our service territory where excessive wire conditions exist, such that we can start a real partnership with the telecom companies to resolve these concerns, which are very legitimate. Certainly,
who's going to identify? I mean, I don't mean to stick up, but who's going to identify? Because I mean, we as the public, I know that, like I said, if I bring it up, but then of course I got to go to 3 or 4 different people in order to get a poll cleared. You know what I'm saying? Like, who are you all actually? Are your folks going out there and identifying these places?
So what we've done recently, or at least last year, we started to look at a sampling of polls to identify where the real significant concerns are. And again, the focus was on Baltimore City in particular as a first cut. And we did identify a number of locations. And in fact, what we've done recently is provide those specific location information to the attaching parties that are responsible for that crowded condition. And the hope is to strike a partnership to address the issues. We have a system in place, an electronic system, which we call a poll activity reporting system, which allows us to provide information, in this case to Verizon specifically, but we're working on an expanded system to manage our attachments, which will allow us to provide real-time information to all attachers. And so the hope is there that will allow those telecom companies to take immediate action. So we can provide the conduit. We can be in the position where we can facilitate a real-time exchange of information from not only the public, but from our line workers as they're out, they see conditions, they can bring it to our attention, and then we can pass it on. One good example of where we've had a success in the past, which many of you may be familiar with, is with respect to resolving double wood pole situations. So a double wood pole is a situation where we set a new pole and we cut the top of the pole, and such that the electric lines are moved to the new pole, but all the communication lines still remain. And this was a source of real consternation for the public. There was action taken several years ago to strike a partnership with our telecom partners and through the Maryland Public Service Commission to create a framework for resolving those double wood pole situations. And what was a significant backlog has been resolved. And again, a similar example where there was a lot of community concern about, call it blight, call it safety concerns, but with the existence of those double poles. And again, we hope we can strike a similar partnership and resolve the issues here. But there are challenges as a result of federal law, and as a result of the fact, at least with BGE, about 80+% of our poles are jointly owned. And so that makes it a little bit more challenging.
Thank you. Thank you.
I've got a couple of colleagues, and I'm going to get to Kramer and Benson in a minute. Let me ask you one other thing. If we converted this bill for now to a requirement that every Maryland utility company and every cable company operating in Maryland would have to submit by some kind of a date certain that is reasonable, a census of all company poles subject to an attachment agreement, as well as a census of all poles subject to the federal agreements and or regulations, and the same would happen with the double poles that you're talking about. And that they would also provide a photograph for each of the locations in the census. If we gave you 12 months or 18 months to get this done statewide, how does that sound?
So I can't speak for the Comcast and Verizon and other attachers, which are really the focus of this particular bill and the concern associated with those particular attachers.
Well, how would it sound to BGE if everybody had to be in it? That's what I'm talking about, all the utilities and the cable companies.
Yeah, we're more than happy to partner with the other utilities, and we do have this, providing copies of utility attachment agreements. That's not an issue. It's a manageable number. They've certainly been provided to the commission in the past. That's really not a concern. It's more about keeping track of all the attachments on the poles. And actually, interestingly enough, the review that we conducted last year, we did confirm, at least with respect to BG's records, that we have very sound records with respect to who's attached to our poles. And so being able to partner, being able to have that conversation is something that we can certainly do. And so the notion of a working group, which I think Chair Kelly, you may have mentioned before, is certainly something that is appealing to us and is something that we think could be a strong conduit for making change that would be in the public interest.
Okay, thank you. Are we going to Senator Kramer for his question, and then Senator Benson, and we're going to the rest of these? We've got a lot of other people to testify on this bill.
Thank you, Madam Chair. Mr. Krieger, just so I fully understand, is it your representation that you cannot have anything contractually with these attaching parties with regard to their maintenance and upkeep of wires on your poles because you're prohibited by federal regulations from having something in your contractual agreements to ensure maintenance and upkeep?
So our agreements, and some of them are actually pretty old, particularly with respect to the poles that are jointly owned, certainly have language that talks about safely attaching to our facilities, making sure that they're maintained in a way that they do not present a safety issue.
No, and I heard that. I got you. You said safety and reliability, and that I heard. But my question to you, sir, is there something that prohibits you from contracting with these attaching parties to go beyond just safety and reliability, but maintenance and other standards that are what's at issue with this legislation? So I'm trying to get a handle on, is it your statement that you cannot contractually have these requirements by virtue of federal regulations? That's what I'm trying to get a handle on. If BG&E wants to say in their contracts with these attaching parties, there will be maintenance standards, can you do that?
Yeah, I think the question is, we certainly could put them in there, whether or not a telecom company would challenge it under federal law as being appropriate to have an electric utility dictate maintenance requirements when they have a right to occupy the pole. I think that would be the real question there, whether it's enforceable. And I don't.
Okay, so the point is, you could require it, you're not doing it, and we have no idea how the courts might interpret it because you simply are holding up your hands and saying, yeah, we have the ability, we have the authority, we can require contractually, we're simply not doing it. That's a big difference between saying federal regulations don't allow us to incorporate these kind of maintenance standards in our contracts. So there's a big difference there, I think, from what we heard and what may actually be the circumstance. So it sounds like it can be done. It's just not happening.
Yeah, I would defer to Mr. Chen again at the PSC in terms of the jurisdictional requirements. I don't think it's a matter of can or cannot. It's really a question of where federal law stands with respect to FCC jurisdiction, which is the current state.
Oh, okay. Thank you.
All right, Senator Benson. Unmute yourself. You gotta unmute, okay.
Yeah, thank you very much. Sir, who owns the poles? Who owns those poles?
So about 80% of our poles are jointly owned between Verizon and BGE. The other 20% are solely by BGE, at least within our service territory. Obviously, it's different in the other utility service territories.
But would it seem sensible that any line that's attached to that pole is the responsibility, with each line that's attached to the pole, it is a responsibility of who owns the poles to set the standard for what is expected as it pertains to those lines that are attached to the pole?
So again, it's a jurisdictional question, which I think Mr. Chen from the PSC addressed already. It's really a matter of who has the right to be on the poles. It's not just a matter of ownership, and we do not have a right.
You mean to tell me that the Public Service Commission determines who has the right to attach a line to your pole, the pole that you all own?
Actually, the FCC, the Federal Communications Commission, has the ability to determine who can.
They have the ability, but do they do it? That's the question.
Yes, they do.
I would think we need to go back to what the chair suggested, that you all need to come together. But I think that this bill is extremely important. If you saw those pictures that were posted so that we could see, you wouldn't want that in your community. You wouldn't want it. Not only that, but can you imagine how dangerous that is for the citizens, for the children? You wouldn't want that in your community. So something needs to happen. And we need to see that this bill is fixed so that it will happen. So thank you very much. I just wanted to make that statement because I think it's pretty shameful.
Okay, thank you. We're going next to Sean Looney, Comcast.
Madam Chair, members of the committee, thank you for the opportunity to testify on this bill. We've had some good meetings with Senator Hayes. I very much appreciate his productive way in which he's addressing this issue. I think we're all in violent agreement that this is a problem. I think the challenge is how to best and most efficiently solve it. In any situation involving safety or service / reliability, Comcast will immediately act upon that upon being notified of any problem. I will admit the communication process has not been as strong as it could be. And I think we've agreed as an industry working with Senator Hayes that we are going to improve that, really using the model of the double pole issue. That was a big issue a few years ago. And we've pretty much taken care of that issue for most cases. So I like the idea of a work group. I like the idea of the utilities and the telecom companies and the cable companies sitting down, figuring out the best process to get this done. I do want, for the sake of managing expectations, when there's a safety or reliability issue, there's no doubt at all that we're going to get out there and take care of that as soon as we're notified. Aesthetics gets a little more complicated because what you may define as ugly may be absolutely necessary to make the network work. And Senator Hayes and I had this conversation the other day, and he said, well, why, for example, would there be a Comcast line and a Verizon line going into the same building? I said, well, if it's a rental and people are moving in and out and changing on a yearly basis, one person may want Comcast service, so the Comcast line's there for them. The next tenant may want Verizon service, so that line is there for them. So a lot of times when you see duplicate lines, there's a reason for that. But going back to the original premise, if we are notified of a safety
or a reliability, and we'll know reliability issue because the customer will call us and say, I'm having troubles with my service. We go out there, we find a problem with the line, we fix that right away. For safety, any wires on the ground, any danger at all of children being impacted by that, we will get out there right away and take care of it if it is our line. So the final point I'll make, and to really put a point on it, and Senator Hayes kind of listened to all this the other day with all of us, the jurisdictional issues on this challenge are significant because you have the FCC, you have the Public Service Commission, you have the local franchising authority, and they all own a piece of this problem and have jurisdiction. So I think that the best way to do this really is let's sit down, roll up our sleeves, figure out the best process to fix this once and for all. Comcast is absolutely committed to doing that, just as like we did with double poles, and we're committed to resolving this issue also. Thank you.
Thank you. All right, we now go to Dan Guy, Pepco and Delmarva Power.
Thank you, Madam Chair, and the rest of the committee. Want to just talk a little bit. My name's Dan Guy. For the record, I'm a manager of smart grid technology for Delmarva Power. I've been asked by Ivan Lanier, the registered lobbyist for PHI, to testify as a subject matter expert on behalf of Pepco and Delmarva Power. Potomac Electric Power and Delmarva Power respectfully oppose Senate Bill 754. Safety to the public and the employee is a core value for our companies. We are concerned with the safety issues that can arise from dangling wires, especially if there are electric facilities. We want to address issues which could affect the service to our customers. Just to let you know, poles in our territories are owned by both PHI and Verizon. And as Damon and Sean said, you know, under the FCC regulations, we're mandated to provide access to our poles for joint use, which is where there are multiple communication companies such as Verizon, Comcast, Atlantic Broadband, Crown Castle, et cetera. They're attached. We don't have the ability to require an attaching company to get off the pole, nor do we as the electric company have the right or ability to repair or remove such attachments. I mean, some of the pictures you saw multiple service drops, as Damon said. And they drop from a pole to feed multiple dwelling complexes, such as apartments or dual housing. We, as like BG&E and Comcast, we want to continue to work together with Verizon or other attachers and in a working group with all the parties at the table to collaborate on working on a solution to solve this problem. Thank you.
Okay. Thank you very much. And that ends the testimony on this bill. We're going next to you, Senator Benson, Senate Bill 846, Home Energy Assistance Critical Medical Needs Program, Power to the People Pilot Program.
Thank you. Thank you, Madam Chair. Good afternoon. And esteemed members of the Senate Finance Committee. Senate Bill 846, Home Energy Assistance Critical Medical Needs Program, Power to the People Pilot Program, requires the Office of Home Energy Programs, OHEP, in coordination with the United Way of Central Maryland and the Fuel Fund of Maryland, to establish the Power to the People Pilot Program by July the 1st, 2022. The pilot program will expand access to the Critical Medical Needs Program and provide training for 211 Maryland United Way Helpline intake specialists and case managers to serve as navigators. The governor must include in the fiscal 2023 and 2024 annual budget bill $80,000 to OHEP for the pilot program. Funds must be used to hire specific staff. The bill takes effect July the 1st, 2021, and terminates June the 30th, 2025. It is critical that this bill is passed. This program has acted as a pilot program for the past several years. However, if it is not codified, this program would be at the risk for falling apart. This program has impacted hundreds of lives thus far. I would urge that this committee please pass this bill and protect some of our most vulnerable citizens in the state of Maryland, are sick. I respectfully once again urge the committee to issue a favorable report for Senate Bill 846. Thank you.
Thank you. All right, now your lead proponent has the 5 minutes. That's Cindy Carter, and your other two proponents have 2.5 minutes each. So Cindy Carter, you're on now.
Yes, good evening, Madam Chair and Finance Committee. I'm Cindy Carter, the co-founder of the Critical Medical Needs Program and Executive Director of Cancer Support Foundation. I'm here in support of Senate Bill 846, Power to the People. The program, the Critical Medical Needs Program, was passed into law in 2019. It helps those who are ill be able to get through the application process to the Office of Home Energy Programs, better known as OHAP, to be able to get grants to keep their power on. It's a very, very successful and powerful program. However, it is based on navigators across the state that work with those who are ill to get these grants done. These navigators at this present time are all volunteers. We have about 300 of them. I don't have a list of navigators that if somebody calls me and says, I need some help, that I can send them to a navigator. Navigators are volunteers at specific foundations or facilities where they work. The Senate Bill 846, Power to the People, establishes as part of the Critical Medical Needs Program, a program of paid basic core default navigators at 211 in the fuel fund. Every program needs a core of paid people to be able to be sustainable. Now, why 211? 211 has been around for years. They have a process, they have a system, they do their job, they are phenomenal. They take calls from people all the time that need help. We've worked with them for years because they refer cancer patients to us. Now, the Fuel Fund, which would have the half a position, they are a founding partner of the Critical Medical Needs Program, and they help with extra funding that's needed and also work with families that may be overqualified income-wise for the energy assistance. 16 years ago, I started running Cancer Support Foundation. We had some of the most medically challenged people in the state contact us through the health department, the Cancer Society, and the hospitals. And these people weren't able to deal with the state, local OHEP offices to get energy assistance grants done. So we sent them to offices to find out what was going on. They had to wait for hours. There's no triage at the local offices to help people that are ill. So then we tried appointments where we call the local office, get them to a specific time to go in. They still were not accepted for those appointments. Then we went to phone calls where the local offices phoned the clients. That did not work out very well. Then we found that the state offered home visits. Now, the state will tell you that they have a home visit policy that takes care of those who are ill. We have worked with across the state for 16 years and finding that the home visit is just not possible for most people. We had a client on oxygen, bedridden, in hospice care. Her brother moved in to take care of her. He tried to deal with the local OHAP office, got nowhere. He tried them in person, he tried them on the phone. They called us, they're about ready to lose their power. We stepped in and through BG&E, through the Critical Medical Needs, before it was actually passed into law and the program was in existence, we got them a 30-day medical hold. We called the local OHAP office and said, we need a home visit. This woman is bedbound. Nobody there that can possibly go in to do anything. We fought for days and weeks, never did get a home visit. The woman finally did pass a couple days before the 30 days was going to run out. The home visit system does not work. Even with the navigator working every day and trying to get it to happen, it's an impossible situation. Cancer Support Foundation feels that 211 and Fuel Fund is the perfect solution. It makes the most sense. These people are experienced, they have systems, they know what they're doing. We are here asking for a favorable action to Senate Bill 846, Power to the People. My 16 years of working with state agencies, I'm not convinced they have a system that takes care of the most vulnerable like the Critical Medical Needs Program does. Critical Medical Needs Program, it works, it does its job. We need to keep it strong. We need to help it grow. And we need to have a core of paid navigators to make sure that those who are ill can always get into this program. We are very much in support of Power to the People, Senate Bill 846. Thank you very much.
Thank you. Okay, we're going next to Karen Mark.
Thank you, Madam Chair and members of the Senate Finance Committee. My name is Karen Mark. I'm the Director of Operations for 211 Maryland, the United Way Helpline. So 211 Maryland, the United Way Helpline strongly supports SB 846, which allows the Power to the People pilot program to reduce barriers for the critically medically ill individuals. This bill will expand the reach for those seeking assistance for the home energy program. 211 is a number that people can call 24 hours a day, 7 days a week, 365 days in a year, in over 150 languages to speak to a live person when facing a crisis and in need. There are 4 211 call centers in Maryland. The largest call center is operated by United Way and serves Central Maryland region, including Baltimore City, Anne Arundel County, Baltimore, Carroll, Harford, and Howard counties. Last year, we fielded over 590 calls from Maryland residents in need. Between last year and this year, our callers requesting medically related assistance such as COVID test sites, public health information increased 95%. The governor dedicated 211 as the number to call statewide on COVID-19 resources and the governor's declaration. With that, we saw the most significant increase in surrounding medical, food, housing, and utilities for Marylanders. SB 846 would allow 211 to not only help close the gap on those in need over the phone and in person, but connect them to other resources that your constituents face, such as food and housing stabilization. That has increased due to COVID-19. All of our staff at 211 have a background in social work and counseling. We are also certified by the Alliance of Information and Referral Services, which is the highest certification available for information and referral providers in the human service industries. We are primed to take on the role as the default navigator for those with critical medical needs. On behalf of 211 Maryland, United Way Helpline, I strongly encourage the committee to issue a favorable report on SB 846. And thank you for your time and consideration.
Okay. All right, we're going next to, let's see, or that you are Karen Mark, to Debbie Brown, Fuel Fund of Maryland.
Good evening, Senator Benson, and thank you, Madam Chair and members of the Finance Committee. My name is Debbie Brown, Director at the Fuel Fund of Maryland. It's nice to see so many of your faces again. I'm here today testifying in support of SB 846, the Critical Medical Needs Program, Power to the People pilot program to help provide home energy assistance to critically medically ill individuals. As we know, the consequences of an unpaid utility bill for people with a critical health issue can be disastrous. Health may decline further in an unpowered home where refrigerated medication is needed or special medical equipment requires electricity to function. The Critical Medical Needs Program currently partners with 5 entities, the Office of People's Counsel, the Office of Home Energy Programs, BG&E, the Cancer Support Foundation, and the Fuel Fund of Maryland. As Cindy mentioned, right now, we utilize trained navigators housed at medical facilities and community assistance agencies statewide. when a critical medical needs patient is referred to the fuel fund from OHEP, they still have a balance due on their BG&E bill. An important component of all of this to make it work is that the fuel fund can access the energy credits from BG&E. So Senate Bill 846 will allow the designated fuel fund staffer to pound the pavement for additional funding resources along with those BG&E credits to pay the utility bill in full for the critically medically ill client. Senate Bill 846 will definitely increase the footprint of the critical medical needs program, filling an important service gap in the community by utilizing the fuel fund's 40 years of established and unprecedented experience in the energy assistant field. To give you some real meat and potato numbers, over the last 8 months, the fuel fund has helped 60 critical medical needs patients with their utility bills. We have provided over $62,000 in financial assistance, and the average grant size to these critically ill patients is almost $1,100 each. So the need for Senate Bill 846 has never been greater. On behalf of the Fuel Fund of Maryland, I respectfully urge a favorable report for Senate Bill 846. Thank you for this opportunity again.
Thank you. Let me ask a question. I'll just ask you since you the last person just spoke. The $80,000 which we would get from the state in order to implement this program is just enough for you guys who are going to get the persons who will work the phones and do the work of trying to do outreach to do that. But the money isn't identified anywhere to actually do something about these bills for people who are critically ill and need to keep their electric service turned on. So how do you see, let me just ask either one of you from these very important charitable organizations, how you see the money coming. Would you see yourself having to do phone-a-thons to raise the funds to actually pay the bills, or should this fiscal note be larger? How do you see it happening?
Karen, you want to go first? I'll let Karen go.
The funding that we're asking for is to kind of be able to pay for a case manager to be able to be a full-time person to comb through the calls that we already receive through critical medical needs patients, to be able to help them navigate with applying for energy assistance a much quicker so they can have their services on. I believe that there already is funding through OHEP, Office of Home Energy Programs, as well through the states that are paying for these bills, as well as in 2-in-1 having some of the smaller agencies like local churches and local programs that were able to connect to that. Of course, we will welcome financial assistance to help more cover the bills of your constituents, but the funding that we're asking is to have a full-time paid person to be able to comb through all of the individuals that we already speak to and provide more campaign to get more individuals to know that we are a center they can call so that we can have this service.
Okay.
Kept on.
That's helpful to know what you really want to do with what you're asking for. Would one paid person be enough? Because you're going to be doing this statewide, right?
Cindy, I mean, I don't know if I personally with 2-in-1, I would love for us to, I believe we wanted to have an intake specialist at its inception of this, as well as a case manager. We do have trained community resource specialists on the phone that can also become navigators, but we want someone who's dedicated just doing this job specifically. But all of our community resource specialists who are on the phone taking calls can also be able to do the same job as well, but we wanted someone dedicated.
And this person would be dedicated just to handle these calls that deal with unpaid electric bills. But you think on a statewide basis, once you get up and going, it occurred to me, will you also need some advertising funds so people know if you're going to, some of the booklets that are put out in the pharmacies and so on annually or quarterly to tell people what to do about various kinds of senior issues or healthcare issues? That's how people are going to know about it.
I can definitely, well, Cindy, I don't know if you had a question and answer for that too.
Yeah, I mean, basically, the funding was to get it started for a position for 211 and a half a position for fuel fund. Right now, because of the volume that 211 has, a lot of the people they have calling in are going to be able to be identified as needing navigators. It means that the people that I get calls from that don't have a navigator, we have now a place to send. Yes, I think as this goes on, because it is a pilot, we are going to have the data then to show that the program does need to be funded with more help because it's so successful. It's amazing how many people are getting helped and I'll tell you, when we started this program, when it went into law, we stopped seeing people being terminated. The program is so very successful to get people in, to get the grants, to get their bills paid. It's made a major difference. So I think we're going to find that there is so much interest because it works so well that eventually we will be back saying we need some more positions. But I think as far as people knowing about the program, because 211 has such, and Fuel Fund have such stellar reputations and people call them from so many things, that it's going to be very easy for them to identify and get a lot of people into the program. Believe me, with something, the good news gets out there quickly. There'll be a lot of people calling. So I don't think they're going to have a problem with getting people to know that there's a program to help them.
Thank you very much. And that ends the testimony on that good bill. Okay, and our final bill of the day is 856, Senator Hershey, electric companies billing information.
Thank you very much, Madam Chair. For the record, Senator Steve Hershey to present Senate Bill 846, which requires an electric company to provide the customer usage and billing information for the customer's account for the preceding 12 months upon request. The information must be available to the customer on the company's website through a PDF or through a physical document sent to the customer. This transparent information will allow a customer to assess their historic data to evaluate efficiency programs and check usage patterns. There are letters of support from the Attorney General, Customer Protection Division, and the Office of People's Counsel. There's no opposition. I ask for a favorable committee report.
Thank you, Senator Klossmeyer. Oh, were you just waving? Okay. Are there any questions? All right, very good. It's a straightforward and simple bill.
Thank you, Madam Chair.
Okay. This ends our hearing for today. Colleagues, tomorrow and Thursday, about a half hour after our hearings, we will be voting. Things are getting hairy now, so try to plan accordingly. Tomorrow and Thursday, voting about a half hour to start after the end of the hearings. Thanks so much, and this ends our hearing.